thank you everyone for joining us. I know that the Lieutenant Governor will be joining us in a little bit, and he'll provide some remarks towards the end of the meeting. I'm going to start with a little bit of housekeeping and updates before we get into the meat of the discussion today, where we're going to be presenting findings from our qualitative and quantitative assessment focused on detention and the use of residential placement. So a couple of logistical updates for you all. Our next task force meeting is scheduled for March 21st. At that meeting, originally, we were hoping to present findings from the rest of the juvenile justice system assessment focused on diversion, adjudication, disposition. But in order to have more time for our research team to analyze data, some data that we just received last week as well, we are going to push that meeting date back a few weeks to April 5th from 10 a.m. to 1 p.m. We still plan on having a meeting on March 21st. We're just going to shorten that time to only an hour. We'll be able to provide some feedback from our advisory boards, share some feedback from youth and family conversations that we've had, which I think is going to be really helpful to the working groups and to the task force in coming up with recommendations. And then we'll also have some time for folks to ask any additional questions about this presentation. So I still want to leave that meeting on the calendar, even though we're going to shorten that time. I do want to say if April 5th from 10 a.m. to 1 p.m. does not work, we know April is a tricky spring break month for a lot of people, but that is the tentative date. So if that date does not work, we would like to know as soon as possible if we have to find an alternate date. So if you know at this point that you're not available and can put that in the chat, if you want to just send me an email directly during the meeting or after the meeting. But as soon as we can know that availability and what that looks like, we can go ahead and put that on the calendar or make arrangements for an alternative date. Secondly, logistic update. In the last email that I sent out to the group, we let you all know about youth and family listening sessions that we were scheduling in the month of March. We sent around a doodle poll for folks to update or to sign up or indicate their availability for one or more of those listening sessions. We've had a few folks sign up for that, but if you all are interested, Stephanie is going to put the link again in the chat. So please click on that and sign up, and we will send out calendar invites for those listening sessions. We may also open up those listening sessions to advisory board members and or working group members, but we also want to make sure that we're not overwhelming youth and families and having 30 people or 40 people participate in a listening session. So we want to open it up to the task force first, and then we'll open it up to advisory board and working group members. So please sign up for those as soon as possible, and we will send out Zoom links for those listening sessions. The other update is on our working groups. Our working groups have either met for the first time or those are scheduled to meet for the first time this week or next week. The diversion working group met for the first time last week. The court process working group is meeting for the first time tomorrow. Data is meeting for the first time on Wednesday, and out-of-home placement is meeting for the first time on Monday. And as you all know, the finance working group has been meeting for a little bit at this point. At those initial meetings, we're just providing foundational information about roles, responsibilities, timelines, some background research, and then we'll start presenting findings from the assessment and starting to talk through potential recommendations that will come before the task force. Also, the SCAO advisory board, I think is what we're calling it at this point, will be tackling a few issues as well. In addition to being an advisory board and providing feedback on all of the recommendations, they are going to be tackling issues around competency and juvenile defense, and potentially issues around waiver as well. And so those recommendations will come from SCAO, that advisory board, and will be shared with the other working groups and this task force for consideration. And they'll function in a similar manner as the other issue-specific working groups. We're setting up then bi-weekly recurring meetings of all of those working groups. And then we'll have a mechanism for sharing information across the working groups back to the advisory boards and back to the task force as well. I think that's all for logistical kind of update status, unless Josh, Stephanie, I'm missing anything. Nope. Okay. And I see a few folks are indicating in the chat their availability. And yes, an organizational chart would actually help me at this point as well. Thank you, Cami. So that's a good idea. We can send that out in terms of the task force, advisory boards, working groups, and who sits on all of them, because we do have liaisons so that we can have a seamless transfer of information across all of those groups. So we will work on that and send that back out to the task force. So in terms of today's presentation, we typically like to start our assessment presentations and do them in order of the juvenile justice continuum. But given some of the data accessibility challenges and some of the questions we've had on the data sources, we are actually starting with the deepest end of the juvenile justice system and talking about detention and residential placement first. And then in the next larger task force meeting, we'll focus on the rest of the system, starting with referrals or point of contact through adjudication and disposition. During the presentation today, we're going to stop at the end of each finding, have time for discussion, have time for questions. We'll also have time for that at the end as well, for people to provide reactions and ask any questions about the data or about the findings, or share how it may be applicable or to their context and what they're seeing in their jurisdiction. So we will have time for that, but we do have a lot of information and a lot of slides to get through as well. So before I share my screen, I also want to turn it over first to Justice Clement and then to Derek to share some of their feedback and reactions. We did meet with them last week to share the presentation and get their thoughts, and so wanted to have them start by providing some additional context. Justice Clement, do you want to go first?
I will. Thank you. Thank you, Nina. Thank you, Josh. And I want to take this opportunity to say thank you to the rest of your team that has been working diligently to pull all of this together, and to take this opportunity to talk to the task force and others that are chiming in and reviewing and part of this in so many different ways. And to say that, we don't have all of the data. We knew that from the beginning, but we really appreciate the work that has been done, both on the qualitative side and the quantitative side, and the two need to work together as we're moving forward. And I would just like to urge all of our work groups, all of our advisory groups, to be looking at this presentation and the findings with a thought of what solutions can look like. I think we all have a tendency to focus on what we believe is working well in our jurisdiction. And I would really urge you to be thinking of what we need to be doing for the state. If things that you see in the finding are not, the findings are not what you see in your jurisdiction, that's great. And we want to hear that, but we want to hear it with a solution focus of how we can be making improvements and be making recommendations from those work groups. If you are on a work group that that is focused on one area and there's findings that you want to you have something to share, please feel free to do that. Just because you're on one work group doesn't mean that when the findings are presented today and presented in April, that you don't have the opportunity to do that. We want to hear from everyone on the task force and from other stakeholders that are paying very close attention to the work that the task force is doing, and being willing and open to what those solutions look like. I'm very excited for today. I appreciate Nina and Josh walking through the presentation. I had some questions. I know all of you will, and we're going to have an opportunity to have discussion after each finding. So I urge you to take that opportunity and chime in when it's appropriate. So thank you.
Great, thank you, Justice. Derek?
Hey, good afternoon, and thank you. I also want to thank CSG for all the hard work they put in during this assessment phase, as well as the task force members and all the stakeholders that put in any work or any feedback and input to help this process. We're very much appreciative. On behalf of DHHS, I'd like to just reiterate that we are committed to a partnership with all stakeholders in juvenile justice within the state. We want to move the needle in a positive direction, and we realize that's going to take a lot of work from a lot of different folks, and DHHS is definitely open and willing to work with folks to help these processes. We face many challenges, as we know. We have issues with our mental health service needs for our youth and families. We also face a staffing crisis in our state that is very real, which is impacting our bed availability on two different ends. Detention side, there's not enough staff to fulfill all the detention spaces available within the state. We also face that same issue on the treatment side, where there's many youth that are unable to be placed into treatment facilities because their staffing crisis is on those ends. We currently have 35 kids on the waiting list for juvenile justice service needs inside the state. And that is, again, a very real crisis with our staffing and a shortcoming we need to do better at. We also have challenges around professional development, helping our frontline workers with more training and better options to help service our children. Also field workers and their abilities to interface with families and the support systems around juvenile justice. Those are real challenges that we face. We want to capitalize on this opportunity to improve the systems of juvenile justice. This is a great opportunity for all. We're extremely excited about this. And this assessment and the work that we're beginning to do in the work groups will bring back a larger body of recommendation. And DHHS will be right there along with all the stakeholders and partners involved in juvenile justice and everything in our power to assist move the needle in the positive direction, as I aforementioned. Thanks again for all the support, and we look forward to rolling our sleeves up and getting to work.
Great, thank you, Derek. So I will start by sharing my screen. Also, I know looking at 60 or so slides of data can be a lot. So please feel free at any point if you need to take a break, use the restroom, et cetera, please do that. Yes, Josh, I can see you're about to say something.
Yeah, just along those lines, I did want to reiterate kind of what Nina just said and warn folks, this is a lot of information that's going to be coming your way. If you're in the system every day, some of it may seem familiar. If you're not, it's really a lot to digest. And so just want to say up front, we really appreciate all the task force members, your patience, your perseverance, but also really your engagement with this material. We may go through some of the slides quickly, but that's because we want time for questions. We want time for dialogue. But really, this presentation and the next one we're going to do are the two most important presentations that we're going to make to the task force. It's really months and months of work, and you'll see that detailed in conversations, hundreds of conversations, data analysis throughout the state. And so we really want to make sure just you all understand what we're presenting, have an opportunity to engage in it, because the challenges that are mapped out in this presentation are going to be the foundation, which, as Justice Clement said, we're going to be devising solutions. And those are solutions that ultimately the task force, along with the working groups, are going to come to consensus on. So just really, again, in advance, appreciate your time and commitment to this meeting, to this process, and looking forward to engaging with this material with you.
Yeah, and I also want to echo Justice and Clement and Derek's comments about the efforts of our research team, but also the efforts of SCAO and individual counties and DHHS in engaging in conversations with us around the data, the back and forth, getting access to the data, all the questions that our research team have asked. Just the responsiveness has been tremendous, and we really appreciate everybody's cooperation. I know it's challenging, but we are going to detail obviously some of the limitations and caveats with the data, and really appreciate everybody's support in getting us to this place. So I am going to share my screen. Can everybody see that? And it's transitioning. Yay, okay, great. So as I mentioned, we are going to start by providing findings around the use of detention and residential placement. The findings that we will be presenting today are based on qualitative information and quantitative data that we have accessed and gathered and analyzed over the last several months. Starting in the fall, we have been engaged in a number of focus groups and interviews with hundreds of stakeholders across the state of Michigan from multiple perspectives, from the various regions, from different types of counties, urban, rural, suburban. We have tried to ensure that we were being representative as possible in these conversations, and thanks to many of you, thanks to the associations and others for getting us access, contact information, helping us schedule at times these conversations. I think as you'll see from the information that we're presenting, we got a lot of feedback. We learned a lot about how various systems are operating in Michigan, as well as where folks find barriers and challenges and where people see the need for improvement. So we engaged in conversations with detention administrators and line staff, with staff and leadership from state facilities and residential providers, court officials, including administrators, judges, referees, and attorneys, managers and staff across DHHS. We spoke to probation chiefs and probation line staff from across the state, county commissioners, folks from behavioral health, including community mental health agencies, advocates, and we also engage in conversations with youth and families. And we have some of that feedback here, but again, in March, we hope to provide you with additional information that we've gathered from youth and families in addition to the listening sessions. And we can detail out, we have a pretty large spreadsheet of all of the folks that we've talked to from across the state. So it's not that we conducted just one probation focus group with one county. We tried to ensure that all of our focus groups were multi-county and that we were reaching different parts of the state. Additionally, our findings are also informed by case level data analysis. So in our last presentation or meeting in January, we tried to set some of those expectations about what data was available to us, where there are limitations and challenges in accessing juvenile justice data. And so for this presentation on detention and residential placement, we were able to access data from two main data sources, one from the Department of Health and Human Services, and then county court data from SCAO, and a couple individual counties that are using a different data system. So for the MDHHS data, this is case level data from 2015 to 2020 on youth placed in juvenile residential facilities that are under the supervision of DHHS, both for dual status and juvenile youth. The county data is from 2016 to 2020, and that's case level data from 10 counties that are representing approximately 20% of the state's juvenile age population. These 10 counties are a mix of smaller counties, a few medium-sized counties, and a couple, I think there's 2 larger counties. And the county data has both detention and residential placement data. Throughout the presentation, we'll indicate which data source we're using for each chart or each slide or finding. And I know that I'll share a little bit more in the next slide around caveats of some of these data, and Josh will do more of that in the residential placement section. I think if I talked about that here, I think by the time we got there, folks would probably have questions. So we'll wait and do some more of that when we get to that section. So a couple or some caveats about our data analysis and some of the limitations before we get started. In terms of the MDHHS data, there was not reliable offense data or incident data, so we could not include that in our analysis. Additionally, there were instances enough where risk was not available. Information about a young person's risk level was missing because a risk assessment at disposition was not always conducted. Additionally, for the county data, there was varying levels of reporting on different indicators across counties. And we understand that 10 counties may not be fully representative of the state. These are not 10 counties that were selected specifically because of representation, but because those were the counties where we had data that we could access. The county data set also had missing or non-standardized offense information and non-standardized definitions for placement types. So you'll see there are a couple counties that we couldn't even use in the detention analysis because they did not distinguish between the type of placement facility, whether that was detention or another type of out-of-home placement. We also had some missing demographic information around race and missing information on risk. And then in the county data where we had placement information, it was somewhat challenging to distinguish between state and county wards as well. And so we'll make that, we'll indicate that on those slides when we get to that section around where we were able to make that delineation. I know, again, in the last meeting in January, we went into a lot more detail about data challenges facing the juvenile justice system in Michigan and how we have a newly established data working group that's going to dive into some of those challenges and think through potential ways to improve data collection, data tracking, and reporting, and strengthen the data infrastructure in Michigan that will help address some of these caveats. But again, to echo, I think what Justice Clement was saying, that even though there are limitations, there are caveats to these data sources, and we would have loved to have access to more robust data for these presentations. I think combined with the qualitative information and all of the focus groups and feedback that we've received through those conversations, that the information that we're presenting today can be helpful, is valuable to helping the state make transformative change. And so we don't want folks to discount the data because there are limitations and caveats, but it does mirror very closely the feedback and the conversations that we've had in our focus group. Lastly, while the presentation focuses mostly on where there are challenges and where we see system change or system transformation as necessary, we also want to note that through our work, through our conversations and our focus groups and the work with the task force, we've obviously uncovered a lot of really good things that are happening across the state at the local level and at the state level. We've tried to uplift some of those strengths, some of those best practices throughout the presentation. And we want to do a lot more of that in the working groups to make sure that the best practices that are happening across the state can be potentially scaled up even more broadly in Michigan. Additionally, while these findings are a summary of key themes and challenges at a systems level, again, we know at the county level, at a facility level, or at a person level that there are a lot of good things happening and people are doing a lot of innovative things to improve outcomes for young people in the juvenile justice system. But the charge of this task force, the charge of the working groups, is to provide a broader statewide assessment of the juvenile justice system, irrespective of who's overseeing young people, where they live, or who serves them. And so that's why we're asking for the task force, we're asking for the working group members to really think about these findings in a statewide lens, and not necessarily just through the lens of their individual county or their individual court system. And lastly, it's important to remember that Michigan is not alone in facing these challenges with regards to its residential placement system. Like many other states around the country, there are a number of challenges facing the deepest end of the juvenile justice system. The deepest end now serves a more complex, complicated population of young people that have really intense needs. We know that obviously COVID, workforce challenges have permeated not just Michigan, but most states around the country. And those challenges have exacerbated some of these issues that we're going to be talking about this afternoon. So we're going to start with findings on the use of secure detention. And again, I'm going to stop at the end of each of those findings before we turn it to the residential placement section. So as I mentioned, there are a lot of key strengths. There are a lot of things that we uncovered at the local level, especially that have in Michigan in terms of their approach to detention. There are many counties in Michigan that are striving to ensure that detention is being used as an option of last resort, that they really are limiting the use of detention to those kids that are a public safety risk. There are a lot of counties that are using a screening tool to inform the use of secure detention, that are using a mental health screening tool. We've identified counties that are using a human trafficking screening tool at the point of detention to inform detention and to address a young person's needs. We have seen some counties that have established their own criteria to make sure that detention is being used for only more serious offenses. We've also seen counties establish partnerships and develop policies to try and ensure that young people are receiving a continuity of care, those kids that have more intensive behavioral health needs while they're in detention facilities, and so they don't lose that care when they leave a detention facility when they're released. And they've created these partnerships to make that seamless transition. We also know at the state level, there have been attempts to ensure that more rural jurisdictions have alternatives to detention through the Regional Detention Support Services initiative. So again, a lot of key strengths. I'm not going to say these are all the strengths. I'm sure there are many, many more, but we wanted to make sure that we've identified some, that especially those where we see that this initiative can strengthen or can scale some of these up more broadly across the state. So the first key finding is that Michigan lacks the statewide policies and guidelines to ensure that detention is used only for youth that are a public safety risk or a flight risk, including an adequate array of detention alternatives. So I'm going to go through some slides to illuminate this finding. So first, I know this is a lot of text. We found that there's limited statewide policies that can inform eligibility for detention, and that local practices in terms of how young people find their way into detention varies considerably across the state. While there are some local jurisdictions that are using a detention screening tool to inform detention decisions, there is no statewide requirement around using that sort of tool. There is no statewide minimum age for placement in secure detention. And so you'll see in a data slide that we have that young people under the age of 12 are ending up in secure detention. Criteria for who is eligible and how decisions are being made to place young people in detention is variable across jurisdictions as well. So just to provide a couple of examples of how this plays out in practice, in one jurisdiction, we saw that a facility can deny a law enforcement official's referral for a young person to detention based on the results from a screening tool. And then in another county, the facility said that they have to accept every young person that is referred by law enforcement, regardless of whether they think they should be in detention or not at that initial point of detention. In one jurisdiction, law enforcement has to confer with the prosecutor for detention eligibility. In another, they have to confer with the judge or a referee. And then in another jurisdiction, detention staff have said that they are the ones that can make those decisions on their own. So again, a lot of variability in terms of who makes the decision and how those decisions are made and what information is being used to make those decisions. We also heard from stakeholders, particularly law enforcement officials, that there is some frustration with this lack of clearly documented eligibility criteria, and that where criteria does exist, law enforcement officers felt that they were not always aware of what those criteria were. And so they felt like if they knew that, they would have more ability to partner with courts to be able to determine if an alternative was appropriate or to know what young people they should be bringing to detention intake in the first place. Another area where we saw variability is in using adult jails for young people that are pretrial. So we know, according to state statute, that young people 15 or older can be placed in an adult jail if they're kept separate for a certain amount of time in response to a behavioral health, or not behavioral health, but a behavioral incident or issue that can take place in a juvenile facility. So if a young person misbehaves, they could be placed in an adult jail. To the extent that that actually happens in practice varies by jurisdiction. We're not saying that it happens a ton. We don't have that data available to us, but we know that in some jurisdictions it does happen, where in other jurisdictions they have made it a policy to not use an adult jail for any purpose. And as a result of this varying eligibility process or criteria for detention, we see that detention is being used for a lot of different reasons besides public safety risk. We see that detention is being used for young people pre-adjudication, but it's also being used for young people as a sanction for a probation violation, as well as a post-dispositional option. So young people being placed in detention post-disposition. We also see that jurisdictions vary in how they're using detention for youth that are committing status offenses. Those offenses like incorrigibility, truancy, runaways, etc. Those offenses that would not be offenses if they were committed by an adult. While some jurisdictions said that they only accept felony offenses, others still hold young people in detention for status offenses. So again, variability in how jurisdictions are addressing those lowest level of offenses. We also heard that young people with intensive behavioral health needs, young people in crisis, are being placed in secure detention to address their immediate needs and not because they are a risk to public safety. That jurisdictions are trying to find alternative placements for these young people, whether they're a psychiatric facility, a hospital, but are not being able to have those young people placed in those institutions immediately. And so to address their needs or to avoid a crisis, they're placing those young people in secure detention. We also heard that younger kids are being placed in detention, even though those cases should be addressed by other service systems, whether that's by the abuse and neglect system or the behavioral health system. Stakeholders expressed that those younger youth often are not youth that should be held in secure detention for a delinquency reason, but again, for protection or to address their needs, they're being held in secure detention. We also heard increasingly, and Derek mentioned this in his remarks, that because of bed shortages, detention is being used to hold youth that are waiting a residential placement. And we've heard that these young people can sit in secure detention for extended periods of time. And we'll see that in some of the data around length of stay that we present shortly. And then lastly, young people, as I mentioned, are being placed in detention post-disposition, and they're staying there post-disposition for long periods of time. But again, we know that secure detention facilities are not meant for long-term treatment. These are short-term facilities meant to house kids pre-adjudication, for those kids that are a public safety risk. And so a lot of these short-term detention facilities are not meant for those populations. They can't provide the services, they can't provide the treatment, and they're not meant to, and they're not required to follow the same standards as QRTPs. We also know, though, that options for secure detention and alternatives in the community are limited across the state. And that is one of the reasons that young people are finding themselves in secure detention, even if they are not a public safety or flight risk. The state does not have a statewide system of support and alternatives. While the regional detention support services exists, it's limited and it lacks the necessary funding to have a broader reach. And it really is only meant to target the more rural or tribal jurisdictions that lack their own detention facility. Additionally, the RDSS system, we've heard, is more surveillance oriented, looking at tethers or electronic monitoring, the use of home detention, rather than focusing on community-based alternatives that can provide more supports or interventions for young people and families. Also, the state doesn't really have a centralized process or management system for detention bed utilization. And so we've heard a lot of instances, received emails about situations where jurisdictions are looking for a bed for a kid who is a public safety risk, but they're having challenges in finding a bed for that young person. And that goes to the second column of lacking the support to find those alternatives. counties and tribes have to search on their own for an available bed or for an available community-based alternative. They call a facility and ask if they have a bed, and oftentimes the answer is no, especially in more recent COVID times. There isn't really formal collaboration across counties and across juvenile justice systems or court systems to find alternatives or beds. And a lot of jurisdictions indicated that there aren't enough community-based alternatives for young people that have behavioral health needs or are in crisis. We also heard that institutions like hospitals or psychiatric facilities are rejecting young people based on their delinquency history or based on the nature of their offense. And so as a result, those young people are ending up in secure detention where that type of intensive treatment is not available. We also heard that racial bias was potentially a factor as to why youth were not being admitted into an alternative setting, whether that's in the community or a hospital or a psychiatric facility. And then we all know that the current context is exacerbating those challenges. The systemic staffing crisis that exists across the state and across the country. Obviously, COVID has limited the availability of beds in each facility. Facilities have shrunk given, in terms of staffing and having to socially distance. And transportation issues, especially for those counties that do not have their own detention facility, but have to transport kids from one jurisdiction to another, especially a large distance, has been a challenge for those counties in particular. So to get into some of the data that we saw behind some of these qualitative findings. Again, we're not able to present offense information today. We are hoping that we have that data now in hand and we'll be able to present some information about detention and the offenses of kids that are being placed in detention in our March meeting. That's something that we hope to have by then. But right now we are able to present some information on demographics and on length of stay. So in terms of who is in secure detention, so what do we know? And this is based on the county level data from 8 counties. I know I said originally we have 10 counties worth of data, but again, one of those counties did not distinguish between detention and other types of out-of-home placement. And one of those counties actually did not have any kids in detention. So this data is based on 8 of those 10 counties. So between 2016 and 2020, the average age for a youth in secure detention was about 14.4 years old. And during that time period, you can see in the chart, about 4% of detentions were for youth under the age of 12, about 23.5% for youth under the age of 14. The population in secure detention during this time period was also primarily male. About 3/4 of youth detained are male. We did break down this data by individual years during that time period as well to see if there were trends, if one population is going up or going down, but the proportions actually remain fairly constant over those years from 2016 to 2020. In looking at race, ethnicity of youth detained, we calculated a relative rate index, which is a standardized way to compare the experiences of different populations of young people within the justice system, looking at racial and ethnic groups. Whenever groups are treated equally, the relative rate would equal 1. Any rate greater than 1 indicates worse outcomes for the non-white population and indicates a disparity. And a rate lower than 1 indicates that the non-white population is actually having better outcomes than the white population. And I want to note, we only calculated this for Black youth because of the relatively small numbers of Native youth and Hispanic youth in our sample counties. And so what you see here is that the relative rate for the 8 counties where we had data, Black youth are detained at 6 times the rate of white youth. And this is consistent with what we see in other states. We know disparities first manifest themselves at the initial point of contact, arrest or referral in the juvenile justice system. but disparities often widen or are greatest at the deepest ends of the system in detention and in incarceration. Looking at lengths of stay for youth in detention, we found that the median length of stay is 14 days, and 1 in 4 detention placements have an average length of stay of 1 month or longer. Also of note is that 20% of detention placements are for just 1 to 3 days. And we think that that's a really important data point to lift up, because those kids are probably placed in detention for non-public safety reasons. Maybe a parent isn't able to pick up a kid, or they're not able to be located. Maybe an alternative in the community doesn't exist, or those kids are being released immediately after a detention hearing. But just being in detention for 1 or 2 days would indicate that those kids truly are not a public safety risk. Additionally, for those longer lengths of stay, we know that these kids might be in detention as a result of a sanction or a disposition. And there are no statutory limits in Michigan in terms of the length of time that a kid can be in detention. But you can see here, 6% of young people have stays in detention for more than 90 days. And again, as we mentioned before, these facilities are not meant or equipped to handle young people and their treatment needs for that period of time. Looking at racial disparities in terms of length of stay, we see that Black youth stay in detention about 7 days longer than white youth. So again, a disparity not just in terms of getting into detention, but how long Black youth are in detention compared to their white peers. And then our last data slide in this section, which I think summarizes maybe one of our key themes pretty well, is the variability of detention rates across the counties where we had access to data. This chart shows detentions per 10,000 youth by counties. And you can see that the rates vary considerably from those that fall in that highest bucket, 138 to 228 detentions per 10,000 youth, compared to the lighter blue colors with the lowest rate, which is 16 to 23 detentions per 10,000 youth. And again, the counties that we had in the sample represent a mix of rural, middle, suburban counties and large counties from different parts of Michigan. And while we're not going to identify which county represents which line, it's not, there's no trends or patterns. It's not that all the larger counties kind of fall on the top and the smaller ones on the bottom. It really varies, and there is no clear trend or pattern by type of county. Also to note in our sample that only a few counties in this data set actually have their own detention facility. So I'm going to stop sharing there and see where we may have some comments, some questions. I see one hand already raised. Representative Leitner.
Yeah, going back to the race slide, I know earlier you mentioned you're having trouble with offenses, but the minority population was detained longer than the white kids. I'm just now, is it for the same offense, or is it because, you know, it's just that's the population that was detained for crimes that were committed?
So great question, one that we often get, and we don't have that data. We're not able to do the analysis here isolating for offense. And we have our researchers here as well to clarify that if I'm misstating. Okay. But what we have seen in other states is that when you do isolate for offense and other factors, that Black youth are still detained or incarcerated at higher rates than their peers for very similar behavior. And we see that all the way from the beginning, you know, when we're talking about school suspensions and expulsions and school-based referrals through each decision point in the juvenile justice system. But to the extent that offense plays a role, we're not able to say that for this data.
Okay, and then the second part of my question is, in regards to data, is it just because you couldn't get the data? or because, you know, I see Justice Clement smiling. Is it because you couldn't get it, or because not all counties report the same to the central repository, or what? Why don't we have the offense data?
Yes. So I'm looking on my screen for Becky or Andrew to talk through that question. I mean, I can talk more about why we don't have more data, but the offense data specifically.
So I'm happy to speak to it, and Andrew, please jump in as necessary. So we do have offense data. The reason why we weren't able to present offense analysis right now is because, without getting too much in the weeds, it's complicated. The way the data are structured, it's complicated to connect a detention event with an offense. So we've had to we've had to do some work to connect the appropriate offense to the appropriate placement, and we are still working that out, and we don't want to put it out there until we're confident that we've got it right.
And just to build on that, we might not be able to do that. So we're only presenting data that we feel confident on, and it's taken a tremendous amount of work to present any data that we feel confident on, because the counties are not capturing the data all in the same manner. So the offense might not be coded in a similar fashion. What looks like a detention for a status offense might actually be for something else. As Becky just articulated, trying to connect the event for which the youth was detained to that specific detention episode. So I think bottom line, what this all reinforces is what I think we all already knew, but even more so, and our research staff have been living it every day for the past number of months, is the data infrastructure is not established in any way where even an average sort of research person without a team of experts could be easily doing this kind of analysis, let alone in a reliable way. So that's the heart of the challenges.
Thank you.
Judge Allen, and then Kim.
Thank you. Great work. I know it's taken a lot, so I'm very pleased that we're starting to get data, quite frankly. Two overview kinds of comments, I guess, more than anything. I know Midland County, we run a court-run detention facility, and the licensing on that facility does not allow for any youth younger than 11. So it's just one of those little footnotes that I think needs to be done, because I think DHHS has done a great job as far as managing that part of detention, because they do the licensing for the facility. And then the second kind of overall comment is that race the age does not seem to be a factor in what you're looking at as far as the data. And that was just effective October 1 of last year. And availability, lengths of stay, availability of beds have been profoundly affected by the increase in the number of kids that we have coming into the system because of the additional year. So COVID is a factor, and we all agree to that. But raise the age was a huge crunch and continues to be a huge crunch. So those are overview kinds of issues. And maybe I'm not understanding. So these are actual questions. There was the slide that said kids are placed in detention post disposition, and I am trying to grasp at what the negative is on that. I mean, that is a lot of times a part of the disposition. So what am I missing here on your analysis?
So yeah, so in terms of the research, I mean, it shows that that detention should not be used as a disposition or as a sanction. That detention is meant to be kind of a short-term place for kids pre-trial or pre-adjudication, that I guess more punitive approach in using that actually doesn't produce or improve outcomes for young people. So there is a lot of research on that. To the extent that that's actually happening in Michigan, again, we don't have the data. We heard jurisdictions that say they use it as a sanction for a violation, but not post-disposition. And then we heard from jurisdictions that are using it post-disposition. But in the data, that's another limitation to the data. We can't actually separate out how many of those detentions are pre-adjudication versus sanctions versus post-disposition. So what you saw in the data is all of that kind of combined.
And just
Okay, so I guess I'm going to take umbrage at the analysis, because if you have a youth that is a community safety risk, and you are providing services to the youth during the time that they're in detention, and that is what we do in Midland County. And what you're looking to do is to reduce the safety risk of that child within the community, then I question the findings on, ipso facto post-disposition detention is bad or negative, because from a judicial standpoint, I am not only looking at rehabilitation of the young person, but I'm looking at community safety and victims and people who are affected by crimes. And that's a part of the recommendations that come through on the analysis.
Yeah. So I think that's going to be a good conversation for the task force to have, because I want to distinguish two things. One is just a language issue that there are some counties that have their own residential facility and that they use post-disposition as a local placement. We are not calling that a detention facility, but there are counties that have a detention facility that is designed for short-term detention that, as Nina said, because of bed unavailability at the state level, because of other issues, those facilities, which are meant for short-term awaiting placement, are instead increasingly being used across the state as longer-term dispositional beds because of the lack of beds at the state level. So that's a challenge in terms of capacity when that facility is not meant to be long-term treatment oriented, isn't spaced adequately to provide that kind of treatment. So there are a variety of concerns where essentially if a facility is not being used for the purpose that was intended. And then I think, Judge Allen, to your point about whether it is appropriate to place a youth not as necessarily a treatment need, but for a public safety reason post-disposition, I think that's going to be a good conversation for the task force to have. What other states have done is try to put in a continuum of both sanction alternatives as well as treatment alternatives like respite, shelter, a short-term residential placement to try to avoid placing youth in a secure detention facility.
Well, so that goes to my next point, that we have developed what I would call quasi-residential type of placements in use of our detention facility, because I didn't feel comfortable placing in residential placements. And it is very specifically guided by psychological services that are independent and risk assessment needs for the kids. And it's an incredible program. And so I would not want to see a broad brush post-disposition detention is bad. And that's how I read that. And so I would be very reluctant to see that put into any kind of hard and fast legislative option or recommendation. So I am concerned about that.
Commissioner Bell?
Yes, good. Hello, everyone. Had to get off mute. Just a comment I wanted to make when I heard you talk about data collection. I think a recommendation, and I'm sure we'll get to this down the line, but I wanted to say it while I was thinking of it. I think a recommendation would be that the state standardizes how they collect the data. I mean, you said that one county collects on one piece of information, another county on another. If we standardize what we're all supposed to collect at a statewide level, I think that would help us going forward as we move to see what our issues are and what situations we have in the state with our juvenile justice. But we first have to standardize and look at what we're measuring so that we're all measuring the same thing. So I just wanted to put that out there as a consideration as we move forward. Thank you.
Thank you, Commissioner. And that is going to be a large focus of the data working group, is thinking through the connectivity, the integration, the infrastructure of the data systems, and how we can have more of a statewide picture. Kim?
Hey, two questions. One is, you suggested some of the young people are coming in with behavioral health needs. And I guess I'm wondering if you have any bigger sense of how many of these kids are coming in with those needs or mental health, or if you have any other information on that, or you've really shared with us the extent of the information on mental health needs within this population.
Yeah, so we don't have data on that. We didn't hear of a lot of facilities conducting mental health screening tools at the point of detention intake to really know the extent of that issue. And that data, where it does exist, is not really available. But I will say almost every, and I can ask my colleagues too, who conducted a lot of those focus groups with me, that almost every focus group in every county said that the largest population that they're having to deal with in secure detention, that they don't feel should be there, but they don't know what else to do, are kids that have these complex behavioral health issues, whether they're kids that have more like crisis, immediate type of issues, or more developed intensive behavioral health issues that need more long-term services or treatment. That is the one population that almost everyone across the board has said is the biggest challenge in terms of how to support those young people.
And the other question is, do you know where, once people are leaving detention, where they're going? Are people going to the community? Are they going to secure placement? Obviously, all of those places, but what proportions those are?
We don't. And I don't know, Becky, if any of that in the next data set in terms of disposition, but I don't think any of that data can be linked to know that, you know, of kids in secure detention that receive these types of dispositions, that data is not available.
Thank you so much for the helpful information.
Other questions, comments, reactions?
Nina, there's questions in the box, in the inbox.
Thank you. I'm trying to monitor hands and the box. And I see Judge Braxton has her hand up, so I'll go there first.
Thank you, Nina. My question is, although we don't have, I guess, all of the stats to kind of go into the details about the disparate treatment between African-American children and their white counterparts, is there any, or are there any suggestions for jurists or anyone else involved in the court system to address this issue? I don't think there's any secret that there is disparate treatment amongst African-American children, African-American people in general, pre-disposition, post-disposition, pretty much everywhere. So the issue is not so much, do we recognize it and do we need the data to support it? The issue for me at this point is, how do we address the issue of the disparate treatment of African-American children in our juvenile justice system, and what can be put into place to address the significant issues that we have seen in the past and those that continue to happen moving forward, to show that Black children are 6 times more likely to spend more time incarcerated. I think it's less about why they are spending more time. Are the charges the same? Or I don't know that we're going to be able to compare apples to apples or oranges to oranges at some point in time. But it seems like with a number that great, the bigger issue is, how do we start to improve upon these numbers for African-American children in our system, and what can be done with this task force or legislatively to address this significant issue that continues to exist?
Yeah, and I want to say first that we're going to make that a central focus of each of the working groups that are coming up with recommendations, is how do these recommendations address equity, and how do we target equity issues directly, not just as part of recommendations, but as their own strategies and solutions, and tackle that head on. I will say though, in terms of the data too, yes, we all know in every state and every county, we know that that's a problem. It's not just in Michigan, it's not just in one county, but having that data to be able to make those comparisons and to really identify the problem and the nexus point is really important. So I will say that that's something we're going to stress heavily in the data working group, is to be able to have data that you can disaggregate by race, ethnicity, gender, all of these different factors at each decision point in the juvenile justice system, at a micro level, at a county level, and at a macro level and the state level is going to be critical. But then each working group is going to be looking at ways to address equity issues through policy, through practice, targeting funding, et cetera. And I don't know if we want to go into some specifics here, but I just want to let you know that that is going to be a central focus.
Yeah, and just 2 quick points to uplift, because Judge, that certainly is a very lengthy discussion that all the working groups will be having. But 2 things. One is it's part of the importance of at least some level of statewide standards in policy and in practice, because without any kind of consistent structure around decision-making tools like a detention screening tool or criteria or limitations, then detention decisions, out of home placement, other decisions are going to be incredibly subjective. And we know from decades of this work, the more subjectivity there is, the more potential there is for bias to come in. So as we think about equity and think about a statewide approach, it's important not to think about rural counties versus urban counties or resource-rich versus resource-poor counties, but kids and families of different demographic groups across the state, and how a more standardized approach could support better outcomes. But we also know for years and decades of juvenile justice systems trying to improve disparities, that alone is not sufficient. That a more standardized approach doesn't consistently result in more standardized outcomes. And so to Nina's point, we will also be encouraging and pushing all of the working groups to not just think about standardization, but equity-specific interventions, programs, policies in order to specifically tackle that head on, because the evidence is really clear across states. Without directly addressing equity issues, there isn't going to be systemic improvement.
The question I see in the chat from Janine around are Black youth in detention longer because of limited alternatives, or is that disparity happening for Black youth in predominantly white communities or all communities? Again, we don't have data beyond just the 10 counties, without broader data, I don't think we can make that kind of assertion or conclusion. But I will say that, when we look at data in other states and across the country, that disparity is happening in all communities and in all types of states. And again, that's where the data is going to be really helpful when we think about what data should be collected at the local and then at the state level. Any other hands up or comments, questions, reactions? Okay. I'm going to share my screen and go through the second finding quickly. There isn't much data there, and then we'll turn it to residential placement. But the second key finding in detention is that the services and supports young people receive in detention do not fully address their needs, and that statewide transparency and accountability for services in detention and for youth outcomes is limited. So we saw variability in the types of services and treatment available to youth in detention, that facilities are struggling to support an increasing population of young people that have behavioral health needs. There was variation or is variation in how different counties are using screenings and assessments to identify and address young people's needs. We saw some that are using behavioral health or mental health screening tools and risk screening tools, and others that do not. Facilities are struggling to provide more intensive behavioral health or crisis stabilization services, and providing young people with continuity of care for kids while they're in detention as well as upon release. That jurisdictions felt that there were limited providers available to work with young people while they're in a detention facility, and that internal staff are struggling, or internally facilities are struggling to staff those behavioral health positions where they can't find providers to work with those young people. We saw that in some counties, local community mental health agencies provide services to kids while they're in a detention facility. And in other communities, they only provide services to youth while they're in the community upon release from detention. We also know that Medicaid eligibility for youth is discontinued when they're placed in detention or any residential placement facility. And that can result in ineligibility for certain services or for certain medications. And then it takes time for young people to have their eligibility status on Medicaid reactivated when they're released from a facility. And that can lead to disjointed services and a delay in services in the community once they are released. We also noted that oversight and accountability of facilities is inconsistent, and it can differ depending on governance structure. I think Judge Allen started talking about this with some of the criteria or licensing standards for court versus county facilities. So we know that county facilities can often have limited engagement with the courts or with the juvenile justice systems. That detention staff are supposed to work closely with the court, but we've heard that disagreements can exist in terms of who is admitted to detention, how long kids can stay in detention, and other decisions around eligibility criteria and what happens in the detention facility. We heard that court facilities may have a better understanding of young people in the juvenile justice system because programming and training for staff is provided directly by the court, and that court-operated facilities have direct control over hiring and staffing of their facilities and can hire more staff that have direct juvenile justice experience. We did hear from county facility staff a desire to transition to being a court-run facility to help them improve operations, streamline funding, and provide a more seamless continuum of options for young people. In terms of licensing or standards, we know that a court-operated facility is inspected by the state annually in accordance with state licensing rules for court-operated facilities, but they are not licensed by the state, so the state cannot pull the license of a court facility or have control over operational decisions. At the same time, a county facility is licensed by the state as a child caring institution, and they have the same rules apply to them as QRTPs or residential placements. There are differences in the standards for court versus county facilities, but both set of standards lack specificity. And we've seen that the licensing standards for court facilities are less rigorous than for county facilities. We also heard a lot from detention administrators and staff about recent policy changes around restraint and seclusion that staff have felt led to having an impact on safety for both young people, staff, and facilities, and that they want to be more involved in developing policies and solutions that may impact their roles in a facility. And lastly, and just to sum up a little bit more what we talked about with the data, that there isn't statewide data right now to answer some of the critical questions to guide system decisions and improvement around juvenile detention. There isn't statewide data on the number of youth in juvenile detention, who these youth are, and why they're placed in detention in terms of offense, demographics, prior histories, et cetera. That there are challenges within the existing data sets in terms of distinguishing who's in detention pre versus post adjudication, who is there for a sanction, who is there as part of a dispositional order. And so it's really hard to understand how long each of these populations are staying in detention, who is there the longest. There isn't a centralized approach to using data to match the availability of detention beds with county needs. And there's a lack of data on the use of restraints and seclusions and how they may differ based on demographics or facilities to know the impact of some of the policy changes that have been implemented in the last several years. So I'm going to stop there. We have one slide on potential opportunities for improvement before we go to residential placement, but I will pause for any comments, questions, reactions. Yes, Judge Allen.
Just to emphasize what a huge deal it is, and Judge Dobridge emphasized this in the chat room, but the cutting off of Medicaid for kids when they're in detention it's just so significant. So it leads to a lot of scrambling for medications for kids who have both criminogenic and psychological issues, which, you know, the focus on the juvenile justice system is criminogenic factors, but we also know that kids that have those criminogenic factors also have psychological problems in a lot of the cases, if not the majority, vast majority. But cutting off Medicaid when they go into detention is a real scramble from a court-run facility standpoint.
Thank you. Other comments, questions, reactions? Not to call on anybody, but Tom, I know we talked about this a little bit in our conversation, kind of the differences between county and court facilities, and obviously with your membership, you see the whole spectrum. Any thoughts or reactions that you would have to that in terms of the different standards and processes that you've heard from your members?
Certainly there's a distinct difference in who has authority over the facilities, but as far as the requirements, I don't know of a facility that doesn't allow licensing to come in and inspect their facility and investigate potential complaints in the same way a county operated facility would be handled. It really comes down to the authority, the ultimate authority of the facility and who is responsible for it. That is the distinct difference. But I think our challenge is it's not that we don't follow standards. It's not that we don't agree with the standards. It doesn't mean we're not willing to participate in those things, because we do. And we do submit volumes of data related to seclusion and restraint, and allow that to be combed through by DHHS. And so, I think it's misunderstood that maybe we don't want to follow the rules or, have somebody come in and look at our facilities. We do it all the time. Fire inspections, food inspections, licensing inspections, you name it, so on and so forth. And I think amongst our judges on this call and judges that are responsible back in those communities that have facilities, they do hold us to a high regard, because those facilities are 24/7 and they are looked at by taxpayers as areas of considerable liability if not managed wisely. So I think our judges take it as serious, if not more serious than anyone, because they're invested from a public safety perspective with the partnerships they have with law enforcement and the public safety consortiums that exist in our counties, to the level of service and programming. That's why Medicaid's being brought up, because judges care about what they hear from their constituents in the courtrooms about what services are lost because kids don't have Medicaid coverage. And so often it's judges coming back and saying, what can we do to provide that service, even though there's a deficiency created by a policy in the state. And that's why many of our court operated facilities have therapists, have nursing contracts, have available services for those reasons. So in a lot of ways, I think that the language is a little hard for what is actually happening in court operating facilities.
Judge Allen, I don't know if that's a hand from before or you have another.
No, it's an additional, it's a ditto to everything that Tom Laddick just said. And I should have brought it up when I initially spoke, but we do have the court-run facility in Midland, and I can't tell you how many audits we go through and licensing. If there are any issues at all, we get surprise licensing visits, and the management is extensive. And I don't know how the conclusion came that there are less licensing requirements in a court-run facility. I am surprised by that conclusion, because we're always being inspected by somebody, and it's the fire department, it's law enforcement, where are the gun holders, and all of the different things that we have to go through. It's constant, and it's appropriate. I'm not condemning it, but I'm just saying I'm not sure that I would view it as any type of a lesser standard than the county run.
Yeah, I think I know Josh is going to be leading this group, but I think it's an opportunity for the out-of-home placement working group to think about not just the rigor of the standards, but the consistency of the standards across the different types of facilities, and to think about what that should look like versus what it looks like now, depending on the type of facility, the jurisdiction, the authority, going forward. Is there an approach that has more consistency and has more quality assurance built in around the treatment, around the services, around the data, and in terms of detention? Any other thoughts, questions? So the last slide here in the detention section, we really just wanted to share some opportunities, given this information, for system reform and system transformation around detention, and we'll do the same in residential placement. It doesn't go into a lot of detail. That's really what the working groups are for, and then ultimately back to the task force. But that's just to showcase some of the areas that the working group is going to explore. So thinking through how to ensure secure detention is being used across the state, only for those young people that are a risk to public safety and a flight risk. So that can't be addressed through community-based alternatives. Thinking through the coordination, the collaboration, the alternatives that need to exist in order for that to be the case. Thinking about, again, a more centralized, coordinated approach to planning for detention beds, and to creating a robust community-based system of alternatives that can be accessed statewide. Thinking about how to strengthen collaboration and establishing partnerships across youth serving systems to address behavioral health needs, to address family crisis needs outside of secure detention. Establishing more robust research-based standards and accountability guidelines and quality assurance mechanisms that are consistent across facilities, and to ensure that staff are trained, facilities have the necessary capacity, and that services provided to young people in detention are effective. And then establishing a statewide data infrastructure to describe, track, evaluate, and improve the detention system. So these are just some areas for potential reform at a very broad, high level that the out-of-home placement working group is going to explore around the use of secure detention. And with that, I'm going to turn it to Josh to talk about residential placement.
Great. Thank you, Nina. So I was joking with Nina before that somehow the residential placement slides are much longer than the detention slides, but appreciate everyone's patience. It's clearly a complicated system that involves local and state actors, private facilities, state-run facilities. So we'll be going through a lot of slides. It's broken up into 9 different findings, and so it won't stop after each finding, but we'll kind of group the findings together and then have time for discussion. But definitely want people to ask any questions they have and reactions, because there's a lot to talk through. Everyone see that? Okay, great. So just like in the detention section, we want to start by sharing strengths. And because the residential system, and again, to distinguish, I put this point in the chat, but for those of you who are less familiar with the juvenile justice system, detention is typically used pre-adjudication, short-term stays. In this section, we are talking about young people who are disposed to a state-run secure facility or a privately run secure or non-secure facility as their longer-term disposition. Involves a variety of different actors, and just like with detention, there's a lot of great things going on at the local level. So first is that, at least as far as we can tell from the data, the use of longer term out-of-home placements, at least when it comes to state supervision placements, and you'll see we'll be talking a fair amount about state supervised placements rather than the full universe of county run placements, because we have the state supervised placements from the entire state, while similar to what Nina described, we only have county placements from 8 to 10 counties. But those placements have declined by about 20 to 30% from 2015 to 2019. So it appears there is less reliance on out-of-home placement. In a lot of states, that's been largely driven by the fact that there are less arrests and there are less kids in the system overall. But still, obviously, a good thing that it appears that, at least for state supervised placements, that those are going down. And in our conversations with counties across the state, it's clear that a lot of folks buy into the research that residential placement really is an option of last resort, and do everything they can to try to keep young people in the community and find community-based alternatives. As part of trying to use placement as a last resort, there are a number of counties across the state that do use validated risk assessments to identify youth level of risk of offending, to identify their criminogenic needs, and to try to guide those disposition or placement decisions and only place kids who are at the highest risk of reoffending. Some counties have even established kind of multidisciplinary or even cross-system meetings or family meetings to try to identify any kind of alternatives in the community instead of placing young people in residential facilities. And when it comes to how young people are managed when they are away from home, there are many counties that engage in active case management with the facility, potentially with the state, and collaborate around the reentry planning, reintegration process. Similarly, at the state level, there are a number of good things happening. All kids that are placed under the wardship of the state are supposed to receive a validated risk assessment and go through a data-driven placement process to really figure out, based on their risks and needs, what the most appropriate placement is, potentially even a community placement. Once a state ward is placed in a facility, they receive ongoing risk and needs assessments to identify if they have changing needs and if their risk is being mitigated. The provider service agreements, the state has agreements for all the state wards in which it places in those facilities. Those service agreements are standardized across service providers with some slight tailoring to different populations. And those service agreements really do emphasize research-based programs and practices, whether that's evidence-based programs or trauma-informed care, an emphasis on family engagement. So a lot of the broad agreement for state supervised youth for the residential placement is based on what we know from the research really does work to improve outcomes. Want to really say that all the conversations we've had with the Juvenile Justice Division staff, is a real commitment to improving outcomes and doing better by this challenging population, and really striving to do so with right now what are fairly limited resources and service options. And then in terms of broader Department of Health and Human Services, that there really is a growing effort to try to strengthen the provider universe and to try to have more proactive, collaborative quality assurance to improve the services and supports that youth are getting in these facilities. And then at the facility level, we did focus groups with from executive directors of provider agencies to frontline staff working in facilities. And a lot of staff are passionate about serving this population effectively and are having to do so in an incredibly challenging time, as Nina detailed, between staffing crises, COVID, resource challenges, new rules and regulations. It's an incredibly challenging time for the provider community, and many staff still committed to this really important work and to doing it as well as possible. All private facilities in which youth in the juvenile justice system are placed are accredited and certified as QRTPs, qualified residential treatment programs. So they are held to a high level of service standard. And youth, while they're in facilities, do receive a wide range of services. That could be counseling, that could be behavioral health treatment, family therapy, educational and vocational services. So there are a wide variety of services available. And staff have to provide those services while dealing with a complicated array of stakeholders and policies. So policies, as we'll get into, differ for state wards versus county wards versus different counties, versus different types of youth. And facility staff show a lot of patience and perseverance having to navigate that complex landscape. And finally, we did really want to make a note to say we did focus groups with youth currently residing in state-run facilities, and they really reported positive experiences with the program and with the staff and felt like there was a real effort to plan for re-entry really from the beginning of their time in placement. So again, like detention, substantial strengths, some research-based and best practices happening in various parts of the state, and really a foundation that can be built upon as we think about statewide system reform. So with that, first key finding, which is that youth are incarcerated, and incarcerated here means both being placed in a state-run or a privately run facility, a secure facility or a non-secure facility, based on pretty varying adherence to what we know from the research is kind of best practice for making these difficult decisions. And the reason for that is Michigan really has very few state laws or court rules that guide or govern the use of incarceration statewide. So in terms of some of the most common policies or court rules that are found in other states that govern the decision and the treatment of youth who are incarcerated and how that compares to the Michigan landscape. First, in terms of the criteria for placement, on what decision or what basis should a youth be considered for out-of-home placement? Many states have put parameters around that, have codified in statute the restrictive purposes for which out-of-home placement should be used. In Michigan, there's almost no language in statute on the use of longer-term out-of-home placements, other than general references to courts using the least restrictive alternative possible. Many states have required that statewide there's a predisposition risk assessment in order to identify whether youth are low, moderate, or high risk to reoffend, and make sure that out-of-home placement is reserved only for those youth that have the highest risk of reoffending. In Michigan, there is no such requirement to conduct that risk assessment, nor is there any requirement to conduct a mental health or substance use or trauma or other kinds of screenings. There is no requirement around sex offender assessments, and we know from the research that general risk assessments don't really work for kids who have committed sex offenses. So really a lack of consistent approaches to risk assessments or behavioral health assessments. In other states where those assessments are required, there's also a requirement that a predisposition report synthesizing all of that information is sent to the judge and the legal parties on the case, so that everyone has a clear understanding of what the young person's risk level is, what their criminogenic needs are, what their behavioral health needs are, and can make the best informed placement decision possible as a result of that information. That is largely not required in Michigan. Some states have a minimum age to limit really young people from being placed in a long-term facility. Michigan does not have a minimum age. Many states have sentencing or length of stay guidelines. So many states have said, as an example, in Texas, youth cannot be placed as a result of a misdemeanor, only a felony offense. Other states create kind of matrix criteria based on the nature of youth's offense, based on their risk level, whether they are eligible for out-of-home placement, and if they are eligible, how long they can stay. Research generally shows that average lengths of stay greater than 6 to 9 months have diminishing returns in terms of recidivism reduction benefits, and actually really long lengths of stay can increase recidivism rates. In Michigan, there are no real sentencing guidelines. The only thing that at least we were able to find in statute was that youth who commit a firearm offense are required, regardless of circumstances, to spend a year in a local detention facility. Can't say whether that's consistently followed or not, but that was pretty much the only statutory guidelines. Otherwise, lengths of stay are basically completely up to individual judges, facilities, case managers to determine. Finally, another area that states have enacted statewide policies or court rules around is what reentry planning should look like, total amount of time that youth can be in custody, including length of time on what in other states is called parole. So after they leave a facility and go back to the community, to make sure that youth are not under state supervision or local supervision for an indefinite period of time. And a number of states have also established criteria for revocating youth, which essentially means violating them on the conditions of their parole and having them replaced in facilities. But again, Michigan largely has no statewide requirements or court rules regarding these areas. Potentially one consequence of that is, and again, we're talking about state supervised youth here because that's the universe of kids that we have. Many of the youth who are being placed under state supervision and in longer term placements are assessed as low or moderate risk to reoffend. So that's with the significant caveat that you see on the right, that we're missing a fair amount of data. That might be because the youth was direct placed and the state never conducted a risk assessment. It might be because the youth started out as a county ward and ended up as a state supervised ward down the road. So there are a variety of reasons why a youth might not have a risk assessment. So you can see of CCI's private placements, we're missing about 23% of records. For kids placed in what we call MDHS placements, so state secure facilities, we're missing about 42% of the placements. But what really stands out with those data caveats in mind is that for youth placed in the CCIs, the private facilities, 75% of those kids for which we do have data were low and moderate risk to reoffend based on the MJAS risk assessment. And for kids placed in the state secure facilities, about 2/3 of those kids were low and moderate risk to reoffend. And again, to reinforce what we know from the research really shows that even for kids that are high risk to reoffending, consistently being kept in the community results in better public safety outcomes and a variety of improved positive youth outcomes compared to being placed in a facility. And so looking at the relatively high proportion, again, with the missing data caveats of low and moderate risk youth that are being placed in facilities really raises a concern about whether there's a consistent commitment statewide to ensuring placement is a last resort. And our conversations with facility staff affirm some of those concerns, whether it's in private placement or in the state facilities. Facility staff often shared with us that they thought many youth who were placed could have been more effectively served in the community. Particularly, they felt that they had a very high population, to the earlier question, of kids who were not actually a public safety risk, and instead their primary issue was a behavioral health need, and that they were being inappropriately placed in a secure facility when what they really needed was a community-based behavioral health intervention. Similar to the detention slide, this also sort of reinforces the concerns about not having more of a statewide consistent approach. The chart on the left is every county in the state and their rate per 10,000 youth of placing a youth under state supervision. And the chart on the right is the 8 counties that we have that includes both county and state wards and their placement rates. And what you see is dramatically different placement rates by county. So you have counties that are placing very few, if no kids under state supervision or as county and state wards. And you have counties up at the top that are placing kids at 5, 10, 15, 20, even 30, 40 to 50 times the rate as counterparts. In trying to peer beneath the data, there may be some trend in that rural counties placement rates are higher, but nothing really consistent that we can pull out of the data. So it's not just a question of being in a rural area versus an urban area or low and high resources. It often comes down to county culture and county system and what kind of investments there have been in alternative approaches. The second key finding, and then I'll stop for questions and discussion after this finding, which also relates to variable approaches and variable experiences, is that Michigan's approach to wardship and the placement process lead to youth being treated unequally across the state, as well as some significant operational challenges and inefficiencies for facilities. So in Michigan, Michigan's approach to wardship is different from every state that, at least that we are aware of in the country. That typically in a state, youth who are placed out of home are placed in state custody, or in some states, youth are only placed in county custody. Michigan is the only state that we've ever worked with, or as far as we know, potentially the only one in the country, where youth can be placed either as a state ward or as a county ward, including in the same facility. So what that means is you can have 50 youth placed in a private facility, and 25 of those kids are a state ward, and 25 of those kids are a county ward, with different policies, practices, and requirements based not just on their wardship, but on their county of origin. And that leads to very different policies and practices for those different populations, including adherence to research-based practices. So first, once there's a dispositional determination that out-of-home placement is being considered, all state wards receive 2 different risk assessments. They received an MJAS risk assessment, and then they receive a third-party CANS assessment, which is a mix of sort of risks and protective factors from an independent third party. Both of those assessments are designed to determine some level of the risk of the young person and help to guide whether an out-of-home placement is really necessary. For county wards, neither of those 2 assessments are required or conducted, and courts have the discretion to directly place county wards independent of any assessment being conducted. In terms of the placement process, if youth are being placed as a state ward, there's a special unit within the state called the Juvenile Justice Assignment Unit that, based on the risk assessment information and based on other information, has a data-driven process to try to determine what is the most appropriate placement in terms of type of facility, type of security, service needs. Counties have complete discretion to go directly to a private placement and determine which placement a young person should go to. And again, some counties may be doing that extremely well and even better than the state. And so this is not to say the state's approach is good and the county's approach is bad. It's to point out that depending on wardship and county, these processes may be done in very different manners. The same is true for young people's experience in an actual facility. So for all state wards, the state has a standardized service agreements, essentially what look like contracts that the state has for all of youth placed in those facilities that maps out a set of service expectations. Counties may often follow those state service agreements, but it's at counties and providers' complete discretion to negotiate an individual set of services and an individual agreement for every young person they place in that facility. The same is true for funding. The state has an improved actuarial rate that is set by an outside third party for all youth that are placed in a private facility. It is up to county discretion whether to follow that state approved rate or to negotiate their own rate for each particular kid that they place within each facility. And sometimes that process works well, and other times facilities shared with us, they feel like courts ask a lot of them in terms of service requirements, but aren't often willing to commit the resources that facilities think are necessary to support all of those required services. Then in terms of ongoing assessments, state wards receive ongoing risk and needs assessments to measure progress and see if needs have changed. If a youth is placed on as a county ward, no such risk assessments are required, and most county wards, as far as we were able to tell, are not receiving ongoing risk assessments. From a case management perspective, if you're a state ward, the juvenile justice specialists who manage those cases are required to have monthly contact with a youth and family. In counties, there is no standardized case management standard or process. Many counties are going above and beyond that and are often seeing youth even more than frequently, but some counties may not, and it might be out of sight, out of mind. So no consistent statewide approach. The same is true for reentry. So youth who are placed as state wards are entitled to certain contracted services from an aftercare provider, receive eligibility into certain state-run supports and programming. County wards often cannot benefit from those same services or supports, and what the reentry planning and aftercare process looks like for counties is also completely variable. The result of this is that youth families and facilities can face significant challenges because of inconsistency across the state in processes and adherence to research. So for young people, as we saw on one of the last slides, youth who are not high risk can end up incarcerated when research generally shows that community placement is better for both community safety and youth outcomes. Because of an inconsistency around who gets risk assessments and how often those are conducted, youth may not have their criminogenic and behavioral health needs adequately identified and directly addressed. Research consistently shows that youth actually receiving services that are tailored to their individualized specific criminogenic behavioral health needs is one of the biggest gaps in both community and residential services. And so inconsistency about the application of risk assessments kind of raises that concern even more. And then youth treatment is really heavily shaped and can be by what county they come from, how active and informed the judge is, how active and informed the caseworker is. That's certainly true in every state at some level, but because of the variation in policies and practices, that is likely true, more true in Michigan than just about any state we've ever worked with. There's an impact for families as well. Families report really inconsistent collaboration and communication, whether that's at the state level or at the local level. Families reported to us often feeling confused about the placement process and understanding what rules and regulations do and don't apply, and generally felt left out of decision-making and that they didn't have sufficient access to their children for either visitation purposes or planning purposes. And then for facilities, this approach to wardship and kind of inconsistent policies and practices makes their job incredibly challenging. So essentially, in a given facility, facility staff have to manage different assessment requirements, different service requirements, potentially different funding levels, different court orders. So rather than being able to run kind of consistent programming or treat youth in a certain way, all of that has to be monitored and individualized and managed. Same thing in terms of dealing with other outside stakeholders. So one county may require a very different kind of case management approach or communication approach from another county versus what the state expects. And so facilities staff, in addition to just having to deal with an incredibly difficult and challenging population, have to manage an array of stakeholders and differing policies and practices depending on the youth and the wardship of that youth in their placement. And then building on top of that, there is then no centralized system for data collection or for progress reporting. So facilities report, different counties have different reporting requirements. They're often having to enter data or share reports or do a court report that looks dramatically different from one county to the next or versus what the state expects. And so it makes any kind of coordinated, centralized approach and efficiencies very complicated. So that's a lot to start with, but want to take questions, comments, reactions. Are people overwhelmed, stunned into silence? Yeah, I will say, usually we try to refrain from too much commentary and just present the facts. But I think it's fair to say we have a pretty good handle on juvenile justice across the country, and Michigan's approach and overall structure to out-of-home placement is the most complex and challenging that we've ever seen. It took us quite some time just for us to understand how it worked. It was just as an outsider, just to understand the language, to understand the wardship, understand the structure. And so as juvenile justice experts who do this work across the country, to really struggle to understand how it works, you just have to imagine that for youth, for families, for communities, it's that much more of a difficult system to try to navigate. I see some exclamations in the chat, but other, Justice Clement.
I had asked.
I'm sorry. Go ahead.
Oh, go ahead.
No, I'm just going to agree with him because every county does something different, as you found out. And, you know, Wayne County, we do it differently than, let's say, Ingham County, than Kent County. And I guess the purpose of this group is to see if we need to standardize our processes and procedures so that Michigan as a whole does it one way, or if having a county by county approach is best for Michigan. I guess we'll know once we get further into some workout groups. But yes, I think it's difficult. You're absolutely right. It's very challenging because every county has its own process and procedures on how they operate.
And I think just before Justice Clement jumps in, it's important that folks don't walk away from this presentation, both in the detention section that Nina went through and that I went through, saying we think everyone should do things exactly the same way. That's that everything should be, you know, state controlled or state centralized. That's definitely not the message that our focus groups and our interviews transmitted and that we want to transmit. The overriding theme of all of these conversations was there's a need for discretion, there's a need to tailor to individual populations, to communities, to stakeholders, but without any set of guidelines, laws, rules, structure, processes then the system can just be completely chaotic and incredibly challenging. And so the push is not for everyone to do things the same way, but as a state and from a state perspective, you want to ensure a foundation, a basic set of standards, of criteria, of processes that are research-based so that everyone's at least operating from the same playbook. Justice?
When we had gone through this before, and I have the same question now on the state versus county ward piece, and how Michigan is possibly the only state that does it the way that we do. I was curious if anyone had any insight as to how we got there and arrived at that, or anything extra that they can provide to explain why our system looks like that. That might help us when we're looking at solutions to be able to address that. And if no one here does, and we need to do that through the work group process, that's fine. I just wanted to put that out there in case anyone had thoughts on it.
Judge Allen?
Oh, I'm just going to tell you, it's the way it's always been done. So, when I got on the bench 22 years ago, it's the way it was done. And as a judge, you got trained to figure out, whether you want a state ward or whether you want the ward to be a county ward. And it takes a fair amount of figuring it out. And I don't think I have anybody in residential placement now, because I wanted to be able to determine the best interests of that particular child. So it was very child dependent and what the risk and the criminogenic needs were of that particular youth. So when I look at the dissection of what the different requirements are under the state wardship requirements, there's a report and there's all that good stuff. But I found that when I had my youth in a state wardship, that I didn't get the reports that I needed. And, there was a level of accountability that needed to just be different. So, I've gone from there being a lot of kids in residential to none, and maybe one or two because of that. But it's always done that way. And I know this may not be appropriate at this point, but, the finances do determine where things are going. I will never forget at my first judges meeting, one of the judges said, well, I had my budget will not be affected when I make all the kids state wards, because I don't have to pay for it. And the state is responsible for the rehabilitation of, of the child. And it's absolutely not true. But, it's like there's not that organizational element. And I'm relieved to hear it's the most complicated system in the whole state, in the United States, because it's not easy from a judicial standpoint to figure it out. It's not. It's really hard.
And I'll just quickly say, and then turn to Commissioner Webster, but a large part of the value that we bring to this work is just being able to hold up a mirror for folks, because when you're in the middle of it, many states that we've worked with, you don't know that other states operate very differently. And this is one distinguishing factor of juvenile justice versus criminal justice, where most criminal justice systems by and large look the same. For whatever reason, juvenile justice systems from one state to the next look dramatically different. And so often it's just, as Judge Allen said, there's a history, and this is the way that we've always done it, and we didn't even know that there was another way that you could do it. And so this is really the work of the task force, and I think what the Lieutenant Governor has been pushing us to do is imagining that something could be very different than what it currently is. Commissioner?
So my question is, and you may not be able to answer this based on the lack of data, but do other states with less complicated systems have better outcomes? Maybe that's just a basic question. Maybe the answer to that question is, of course, that's why we have this task force, but sometimes we think we have to change something just because it's complicated, but is it truly affecting outcomes?
No, it's a really good question, and one that we've spent a lot of time talking about internally, because we don't want people to come away with, well, shrugging their shoulders and saying, well, everyone does things differently, but maybe that's not a bad thing. We're going to show some data that we aren't able to look at recidivism rates or technical violations. We'll show some data that raises questions about how well youth are faring in out-of-home placement. At least what we can say is, from a process perspective, we know generally that if kids get research-based practices, like if they get risk assessments, if they get services tailored to their needs, if they get evidence-based programming, if they get sufficient reentry supports, they're going to have better outcomes. What we can say is that's not happening consistently across the state. It's happening for some kids, it's happening in some counties, but there isn't the foundational infrastructure in place to make sure that that's happening for everyone. And therefore, some kids are certainly going to have worse outcomes.
So it's assumed, and probably rightly so, that because those things are missing, outcomes probably are not what they could be.
That's
Is that
right.
accurate?
Yeah. Okay. Well, we have a lot else to get to, so I'm going to share my screen and go through some more findings. So the next set of findings is about the residential system. And these challenges are exacerbated in terms of the residential system. We've talked about this a little bit by recent events, but, and this gets at Justice Clement's question, to some historical challenges about the capacity and the attention given to the juvenile justice system. So first, and I'm glad Derek used this word, and I know we don't want to use the word crisis lightly, but I think it's fair to say that the residential system in Michigan right now is in a state of upheaval, if not crisis. And that's due to a number of factors. We've talked about this a little bit, but one is a number of facilities have closed because of violations, because of tragic events that have occurred in facilities, because of a renewed focus from DHHS on holding facilities accountable. And so there's just less bed capacity in the system overall. In the meantime, Michigan is experiencing what other states across the country are experiencing, which is just a broad staffing shortage. Turnover in facilities is incredibly high. And so even in those facilities that do exist, not all the beds can be utilized because there's not enough staff to manage a fully utilized population and maintain sufficient child to staff ratios. And the staff turnover, obviously beyond capacity, has incredibly detrimental effects on the expertise of and the experience level of the people in facilities, of their training, of their ability to work with an incredibly difficult population. So the staff shortages are creating both a bed crisis as well as substantively a huge management issue for facilities, a liability issue, a variety of challenges. COVID-19 has certainly exacerbated all of this. In terms of both social distancing requirements, limitations on bed placements, healthcare, and other health issues that need to be managed. And it's also fair to say that the tone of our focus groups with the provider community, both on the detention side and on the longer term residential facility side, was, to be putting it nicely, very animated. That relations right now between, and feelings from the provider community with DHS in terms of how some of the policy reforms have been implemented, in terms of the amount of support that providers get from DHHS, is really very strained, and providers sort of saying to us in our focus groups that they're thinking of pulling out of the juvenile justice business because it's just not worth it and it's too frustrating. So some really significant challenges at this moment in time that really need some systemic solutions. One of the challenges, and we've talked about that before, is that kids are staying in detention for a significant period of time. And what this data shows is actually even before recent events. So this chart is 2015 to 2018. kids were already spending a significant amount of time in detention as part of their overall residential stay. And when I say overall residential stay, the way that we looked at the data was from the moment that youth were determined that they were going to out-of-home placement post-disposition through their entire single placement history. So for example, a youth could have been placed in a private facility, come back to the community, revocated, gone back into detention, and then gone back to a private or a state facility. So when we look at that entire experience, youth are expending a significant period of time in detention. And part of that might be, again, we don't have recidivism data, but it might be because a lot of youth are in fact getting revocated when they come back to the community. So what this data shows is almost 30% of kids who were state supervised spent 90 days or more in a detention facility. So this is not a residential placement. This is in detention as part of their overall detention, overall residential placement experience. 70% spend at least 30 days in detention. And so this just shows this is just detention, not overall time residential placement. Kids are spending a significant amount of the time in detention, which is likely even greater because of the recent strain on the residential system capacity as part of their residential experience. And we heard anecdotal reports of that this has gotten so much worse that there are kids spending 9-10 months in detention awaiting a bed in a facility because of the residential system management challenges. And a lot of that is because the basic infrastructure isn't in place, whether that's to manage the kind of crisis that's happening now, or just in a more ongoing way to really manage in any kind of centralized way the state residential system. So there are some basic kind of foundational prerequisites needed to be able to manage bed utilization and making sure you have the right number of beds. So the first is being able to quantify the population. We cannot tell you, despite a lot of time and energy spent, how many kids are placed as state wards and county wards in a given year. That number does not exist. And so without that number, as well as without any risk data associated with that, to be able to say, well, are those kids the highest risk kids and should they have been placed? There's no way for Michigan to really project what is the population of kids that likely do require some level of out-of-home placement. There's also no criminogenic data or behavioral health need data in a standardized way based on that population. And so not only can you not plan for the number of beds that are required, but it makes it almost impossible to say, how many specialized beds do we need? How many beds do we need for kids that have really high-end substance use needs or mental health needs? Or kids who are sex offenders, which is a specialized population and often needing a specialized residential program. And then what complicates that is there are no common expectations around length of stay. So when there are no parameters around length of stay, and length of stays can be completely variable, there's no projections that can be done to try to identify average lengths of stay based on the average population and understand what that means for turnover of beds and then how many beds are needed. Likewise, there's just like detention, there's no centralized bed management system. So there's nobody at the state level or the local level, or there's no collaborative planning between the state and locales to really try to get a handle on what are the bed needs for kids in the juvenile justice system, what kind of capacity needs to be built. And so not just sort of the lack of infrastructure around short-term planning, but no sort of longer-term visioning, strategic planning, at least as it pertains to the juvenile justice system, about what kind of residential capacity is needed and what services should be offered. And then the other sort of foundational challenges in order to have a flexible residential management system is you need a flexible procurement process. I'm talking a little bit about why that's not the case. And then a workforce development strategy in terms of how do we create a pipeline of employees that are willing to work in these facilities? How do we train them? How do we incentivize them? How do we retain them? How do we make staff at facilities feel supported? And again, this kind of centralized, coordinated infrastructure doesn't exist. And so particularly when a crisis like the one that's occurring now happens, there's really no capacity. The system is not nimble and is not able to really effectively respond to these issues. The challenges with the system are really historical. And part of that is the Juvenile Justice Division within DHHS really being isolated. It historically, and this is often the case, sadly, in states where juvenile justice is part of a child welfare agency, the child welfare agency child welfare population is often just much bigger. And quite frankly, kids who are placed in the child welfare system are the state responsibility, while kids who are in the juvenile justice system are often a local and state responsibility. And so kids in the juvenile justice system just don't get the same attention and resources. And so often, in many of our focus groups, folks would say, well, the state's not doing this and the state's not doing that, and we need a new Bureau of Juvenile Justice. And the reality is the division just can't possibly play a leadership role, do all the things that are needed to support the residential system because it really lacks the staff and the resources, as well as the mandate and support both internally and externally to play those roles. And these are sort of long-standing issues with juvenile justice and how it's situated in Michigan. One sort of concrete manifestation of that is that for youth that are supervised by the state, the juvenile justice specialists that are assigned to do the case management of those youth are not in any way supervised by the Juvenile Justice Division. So the individuals that are doing the case management for the most challenging population of kids in the juvenile justice system are not under the direct supervision or the direct management of the division. Instead, they're supervised by local child welfare offices. And largely, except in very large areas, those juvenile justice specialists are not, in fact, juvenile justice specialists. Most of them actually have more of a child welfare caseload than they do a juvenile justice caseload. There's very little direct training and minimal support around juvenile justice when they're getting supervision. There's very little distinction made between their juvenile justice cases and their child welfare cases. And that's kind of a further attestation of the lack of prioritization of juvenile justice cases. For those specialists, juvenile justice cases are not even counted in their caseload calculations. So there's a cap on how many child welfare cases you can have and caseload requirements. Juvenile justice cases essentially don't count towards that cap at all. So you can have as many of them as you can really handle without any planning for whether that's a reasonable workload or not. We'll talk about more on this in a bit, but the DHHS, which does the licensing, which does the quality assurance, which does the training, which provides the regulations, which collects data for the private facilities, pretty much all of that is geared for the child welfare system. And while, yes, there are overlaps in the population needs, yes, there's certainly overlap in the actual population. We'll talk about dual wards. The goals of the juvenile justice system are different. The population is different. The needs are different, and research and best practices are different. And right now, none of that DHHS infrastructure supporting and holding providers accountable is really tailored to the unique needs of the juvenile justice system or the juvenile justice population. And so unsurprisingly, as a result, facilities, not just the division, but facilities, both state-run facilities and private facilities, many staff also feel isolated, they feel unsupported, and they feel like there is not a realistic appreciation, both from the state as well as from locales and courts, about really the challenges that they experience to serving this population as effectively as possible. I'll do this quick finding and then we'll stop for questions and discussion, but certainly what relates to this is the approach to funding for residential placements and whether that funding approach really supports improved youth outcomes and efficient resources. So from the state's perspective, there are some systemic issues with the way residential system is funded. At the broadest level, counties have no incentive to keep youth in the community. Judge Allen sort of spoke to this. At minimum, the state reimburses counties the same for a community-based placement as it does for a residential placement. So many states, for example, have created all sorts of funding formulas and funding incentives to try to incentivize counties to keep youth in the community. That is not true in Michigan. The reimbursement rate is the same. At the same time, this is another way Michigan is unique. I think Michigan's the only state we've ever seen where there is no competitive procurement process for residential services. State government usually sort of very extreme in the other direction, wanting to make sure everything is an open, fair, competitive process and competing all services. That is in fact what happens for community-based services. But for residential services, basically providers just have to get licensed and sign a service agreement with the state. There's no competitive request for proposal or independent scoring and review process to choose the providers that are best equipped to provide those services. And as a result, there's no independent contracts. The relationship between the state and providers is generic service agreements, and there aren't individual contracts with individual providers outlining specific expectations. On the provider side, they have concerns with the funding structure as well, generally feeling like funding rates are insufficient, that they don't really take into mind the unique challenges of serving the juvenile justice compared to the child welfare population. And given all of the administrative hassle and complexities that they have to deal with, that the funding rate doesn't, for example, account for the fact that they have to have 5 different data systems because of different county or court requirements. Providers shared that there's been no cost of living increase in years on an ongoing basis, and certainly at a time when inflation is rising rapidly, and they want to have competitive salaries to retain staff. That's a real concern. And also as a bed management issue, that there is no unfilled bed rate, which basically means if providers have fallow capacity and don't have beds that are filled, they don't get any payment for those beds, which many states do, which basically penalizes them and gives them an incentive to try to actually get more kids placed so they can operate as efficiently as possible. And then there's a set of shared concerns which relate to both of these, which is because there are no competitive procurements, because there are no individualized contracts, that funding for residential services really is not performance-based. It's not outcome-driven, and there's no incentive for innovation, creativity, or for evaluations to really ensure that the best providers are those that achieve the best outcomes. So again, a lot there in terms of current challenges, structural challenges, funding challenges, but comments, questions, reactions? Judge Allen?
You're on mute.
You're muted, Judge Allen.
Sorry. I am relieved to get this depth of an analysis of the system that I've been dealing with kids for 22 years. So I really appreciate the level of detail here and want to applaud the efforts of CSG in doing this. So let me just give affirmation, I guess, would be the way that I would look at it to various points that were brought up. First of all, that the residential system is in a point of crisis, and I would be remiss in that data point for everybody on this task force from my fellow judges, and it's just it is an incredibly it's a system right now that is not benefiting young people as far as residential placements. They are in dire need, and the judges, and I speak from a judge perspective, it is what we lose sleep about. If we know that there is a need of a young person who has criminogenic factors and also has other needs and can't find the right treatment for that child, that is the thing that grinds us all down. And it's very, very difficult to be managing a courtroom system when there is this crisis going on in residential care. And then the delineation of what are within the residential placement system that we have in Michigan is quite good. That DHHS is geared for child welfare and not juvenile justice. I mean, it's just the way it is, and it's the numbers. And thankfully, we don't have as many numbers in juvenile justice as we do in child welfare. That's kind of the reality of it. But there are reasons that that there's not the same attention, and the funding, the lack of funding incentives is huge. I mean, it's just huge for counties, because we are all, we're all reporting to our county board of commissioners and to the taxpayers and to the people that vote us into office. And what is the incentive other than a reduction in juvenile crime? That is its own reward, and let us not forget that. But when you don't have incentives, you don't have the individual like creativity in being able to meet the needs and the risks of that young person, in being able to know that when you send them to a residential placement, that they're going to come out better. And I don't have that security, except when I when I manage things, within my own community, and with the different things that we're doing. And I do think that the lack of competitive procurement process, that's in there being what I would call just kind of a single contract that gets signed by people institutions providing residential care. That's not what we need. What we need is if there's going to be a mental health bed, that's what they're called, then we need to be sure that there's a competitive process that puts the right people in that residential placement. And as a judge, if I don't know that I have somebody being placed in a residential treatment for, let's say, sex offender treatment, and they're going to come out and they're not going to reoffend, then why would I spend the money on that from my own budget? So the lack of a competitive procurement process is huge, and performance-based. There are no outcomes being reported, really, when all is said and done. The lack of recidivism information statewide is stunning to me, because we cannot rely on anecdotes, and that's kind of what you sometimes have to do. Well, maybe this will work for this kind of an offender. So kudos to all of you for figuring it out and laying it all out very nicely for us. And really, it was like, whew, here we go. There's the explanation. And I think it's all understandable. It is to me anyway, but I've been working in the system for 20 years, so thank you.
Thanks, Judge. So more to share, but it would be great. Any of those of you who haven't spoken so far, again, I know it's a lot of information, a lot to take in, but any comments or questions from those of you who haven't spoken up so far? Rep. Leitner.
Yes, thank you. Another question I have, and you might have mentioned it and I missed it earlier. What other states do it well? Like, we talked about how complicated our system is as far as the child care fund. And then Judge Allen, I talked earlier about Raise the Age. So what couple of states are kind of like outliers in collecting their data and being able to actually tell what's going on in their system and what programs work? Is kind of like a central data hub place that has collaboration of data and processes.
Yeah. So that's something that we've started to share with the working groups, Rep. Leitner, and will continue to do so. But I think it's fair to say, sort of to my earlier point, our encouragement or our push is not going to be everyone needs to do everything the same. But I think it's fair to say, based at least on states that we know, that Michigan has the least centralized, decentralized system of any state that we know in the country. So as an example, like Washington and Ohio are two states that also have locally run systems, but both of those states have a statewide risk assessment. They have a statewide commitment and funding for evidence-based programs and practices. They have a statewide quality assurance and training infrastructure. They have a statewide case management system and court database. So even though those systems have locally run systems and kids placed in state custody, they still have established many elements that that help the state to operate in a coordinated and effective fashion. And so we'll be sharing those examples. We'll bring speakers from other states to share those experiences. But most other states have tried to at least develop some of that more coordinated, centralized infrastructure. Any other questions or reactions at this point from folks who have not spoken up so far? All right, well, there will be more opportunities to come. So I want to be mindful of time, so I'm going to go through some of these slides a little quickly, but again, want to stop for questions and comments. So what we haven't spoken a ton about before, it's been more systemic challenges. It is what actually happens in facilities. And, again, unfortunately, this is mostly anecdote, but there are some consistent concerns about to what extent kids are receiving research-based services and supports. So in terms of hallmarks of what we know from the research works, one is risk assessments, to be able to measure what are individualized kid-specific needs and are services tailored to those needs. And typically county wards don't receive any ongoing risk assessments in private placement. While for state wards, facility staff report mixed buy-in for the use of the Michigan juvenile assessment system risk assessment and whether they're consistently using that to guide treatment decisions. And generally, there isn't any kind of statewide quality assurance infrastructure related to those assessments being done accurately. So for state wards that are placed in a private facility, it's actually the providers that are supposed to be conducting those risk assessments, which again is a little bit unusual. Normally that's a public agency responsibility. With the providers conducting them, it becomes really hard to then have confidence in, are they doing them correctly? Do they have the training? Is there any third-party monitoring to make sure that those risk assessments are actually used correctly? And that infrastructure largely does not exist. In terms of services, so the good news is the service agreements have language around evidence-based programs, but that's not backed by a real commitment to evidence-based programs and building capacity around that. So, for example, Washington State has identified 5 or 6 evidence-based programs that, based on their rigorous research, have better outcomes, and those are the only services that facilities are able to provide. In some facilities, there might be a true implementation of evidence-based programs, but a lack of quality assurance to make sure those programs are implemented effectively. In others, what might be called evidence-based isn't in fact have any evidence around it. And so just a lack of infrastructure around evidence-based programs being provided in facilities. Real concerns on behalf of all facilities about the dearth of substance use and mental health programs, interventions, and staffing expertise. And on the flip side, youth and families, a significant theme of our focus groups with them, is feeling like medication is overly relied on and overly used to address issues in lieu of more therapeutic treatments. Also concerns about the educational and vocational services that kids receive while they're in placement. At a structural level, the teachers in facilities are generally not employees of the local school district. So states do this in different ways. In some states, every educator in an out-of-home facility is an employee of that local school district or the state. In Michigan, that's not the case. And so a number of focus groups raise concerns about teacher credentials, around whether a rigorous curriculum is being used and whether that's being really aligned with state standards. On a broader level, concerns about how much instruction and education kids are actually getting. And are kids actually getting time teaching, particularly kids with special education needs, or are they just being put in front of a computer and not really making much progress? Similarly, significant variation around access to post-secondary education, access to vocational training and workforce certifications. Again, for state wards, that system might be more robust and there's a partnership with the state workforce development agency. County wards may not be able to benefit from those same services. So access to ongoing education and workforce development opportunities, which are particularly important given an aging population, given raise the age and the kids who end up in facilities is needed for transition to independent living, varies significantly across the state. And then at an overarching level, unclear to us that there is much examination, scrutiny, or accountability about kids' educational and vocational progress. Certainly no systemic data that we could identify, certainly no statewide data. There has been longstanding concern and data that shows nationally that kids, when they leave facilities, they don't get reintegrated back into their community schools, that they're often sent to alternative schools with loose academic standards, and they often don't even connect to any school or vocational program at all. But that data and accountability for maintaining young people's educational and vocational progress is really lacking. Similar concerns around family engagement. Again, family engagement in pockets is happening in a variety of ways. There are family team meetings that with some facilities and with some counties and with some staff are happening on an ongoing basis. But it's inconsistent, and families generally reported to us that they don't feel empowered and really that they're being partnered with to guide treatment and reentry decisions. As part of that, they feel like all kids are being treated the same way no matter what, as opposed to really partnering with families and young people to understand their individual situation, their risks, their goals, cultural competence, and really develop an individualized engagement and service plan. And at a broader level, there are really limited, if any, certainly at the state level and very few at the local level, formal structures for family engagement. So whether that's a family advisory council, whether that's surveys with families, whether that's parent advocate groups, whether that's family resource specialists with lived experience in the juvenile justice system, a lack of just formal structures to really commit to family engagement and make sure family feedback is shaping and informing the residential system. And then finally, from a behavior management standpoint. So again, great that service agreements with providers that the state manages require trauma-informed care, but it's unclear what that actually means in practice. And at least on the juvenile justice side, there's not a robust system of training or quality assurance to really ensure that residential service environments are trauma-informed. There has been statewide restrictions, but no ban on the use of restraints in facilities or the use of isolation. And the restrictions that have been in place have been experienced by providers as rushed, as punitive, and as not sufficiently planning for what are viable, realistic alternatives with an incredibly challenging population. And for many providers, this has deepened their sense of isolation and their feeling of lack of safety and security because they're being told what not to do, but not being supported to put alternatives in place. Also, really importantly, there is no independent ombudsman in Michigan for handling complaints that youth may be experiencing maltreatment in facilities. So youth have to report their concerns to facility staff, and facility staff then share those concerns with the DHHS division responsible for handling those complaints. And even DHHS acknowledges that those complaints are often used against kids, and kids may not be speaking out for fear of reprisals. And so really the lack of any independent way for youth and for families to make their concerns known. And then finally, to the question of, well, how much does this impact what's actually happening to kids? We tried thoroughly to collect data on restraints, on the use of isolation, and then ultimately decided the data that was shared with us was not reliable or accurate enough to make firm conclusions. So the question to what do these challenges really result in? We can't speak to recidivism, we can't speak to revocation rates, but what we can speak to is youth are spending a lot of time in out-of-home placement, in multiple placements, and often have more than one experience under state wardship, which all raise the question of whether kids are adequately getting their needs met. So first, in terms of lengths of stay, and again, this is not in an individual placement, but in a single placement episode from start to finish. 70% of kids who start their experience in a private placement spend 9 months or more in total out of home, and this does not include detention. And 90% of state supervised youth who start in a state facility spend 9 months or more total out of home. And if you look at that last row, the green bar, 30% of kids placed in a private facility spend 18 months or longer out of home, while those who start in a state facility spend almost 40% spend 18 months or longer in a facility. So again, this does not count time at home. That's an incredibly long time to be spending in a facility. As I mentioned before, there's not a ton of research on lengths of stay, but the research that does exist suggests after 6 months, after 7 months, you hit diminishing returns pretty quickly, and that longer lengths of stay can actually exacerbate challenges in facilities and lead to higher rates of recidivism. So going back to where we started, which is the lack of any kind of state standards or guidelines or parameters around length of stay, it is leading to a very significant concern that kids' time out of home is very substantial. Part of the reason why kids' time out of home is substantial is because many kids are experiencing not just one placement, but multiple. So again, this is for youth who are placed under state supervision. About 50% experience more than one non-detention residential placement during their stay, and 25% experience 3 or more separate placements during one stay under state supervision. That's even higher for dual wards. Dual wards are kids who are both in the juvenile justice system and in the child welfare system. About 16% of all state supervised wards were dual wards, and half or more of them experienced 3 or more placements, with 30% experiencing 4 or more separate residential placements during one period of time of state supervision. So it again paints a picture of kids bouncing from facility to facility, kids spending a long time in out-of-home placement, longer than what research would say is necessary to get their needs met, all raising questions about the effectiveness of that time spent. And what adds to that is, again, mostly focusing on state supervised youth, because that's the statewide population we have. Almost 40% of the sample that we had from 2015 to 2020 had a prior state ward experience, and almost 50% of dual wards had a prior state supervision experience. And again, you saw for many of those kids, that experience is 12 to 18 months. So it again raises the question, is that time in under state supervision or under county wardship really addressing kids' needs while they're in residential placement? Because many of these kids are experiencing very long placements and multiple facilities and multiple time under state or local wardship. So finally, before pause for questions and discussion, reentry planning. As you can imagine, reentry planning, given this fractured landscape, is also incredibly challenging. Whether a young person is a county ward or whether they're a state ward, because of the sort of fractured system, there can be multiple entities involved in the reentry planning process. For a state ward, you could have a state facility staff person, you could have a juvenile justice specialist, you can have the court involved, you can have the community mental health center involved, families, if you're a dual ward, the child welfare system. Again, this reentry is complicated in every state, but is particularly complicated in Michigan because of all the various actors involved. And there's no formal collaboration structure. So there are, on a case level basis, family team meetings that are supposed to be occurring, but on a systemic basis, no structure exists. So for example, many states at the local level have local reentry councils or reentry committees that help to coordinate reentry services, that have membership across service systems to be able to figure out what the best reentry services are. Michigan is the opposite. So you can have two different young people going back to the same county. One is supervised by a state juvenile justice specialist. One is supervised by a county probation officer or case manager, and their reentry experience might be completely different. Their service experience and what is known about available reentry services might be completely different. And that state staff person is never talking to the county case manager to share information, services, and strategies about what might be available to support that young person's reentry. And so as a result, reentry challenging in general, especially for older youth, and especially finding behavioral health services, independent living programs, but particularly for juvenile justice specialists that are not part of the local court structure, nor are they really part of the state juvenile justice division structure. They're really left to fend for themselves, to identify juvenile justice services, the training they receive, the programs that they're aware of, the information provided by their supervisors are about child welfare, not about juvenile justice. And so really left by themselves to figure out reentry services for a very challenging population. We've talked about how Medicaid, also an issue for youth that are going into long-term placements, that can complicate, and insurance issues can complicate kids getting sufficient and timely services when they come back to the community. And then finally, juvenile justice specialists who are used to playing a case management role are being asked to essentially play a community supervision probation officer role when youth come back into the community after a placement, essentially on a period of parole. But they receive no training and have very limited policies or protocols to guide how they should deal with that kind of public safety supervision aspect of their job. So again, to reinforce, that doesn't mean there aren't wonderful things happening in individual facilities, with individual case managers, with individual judges, with individual counties, with individual juvenile justice specialists. In fact, as hopefully this is making clear, they often have to fight through extreme challenges and hurdles to be able to provide good services. But it does mean a lack of consistent service approaches and coordination and collaboration of how kids experience the residential system. Questions, comments? Too many slides and people are feeling overwhelmed.
Hey, Josh, this is Derek. And sorry,
Yes,
I can't raise my
please
hand
jump in.
because I'm on my phone. Yeah, I'm on my phone, but I just wanted to point out a couple things. One, as previously noted, we are DHHS is extremely committed to making the necessary revisions to improve the system. I believe I'm uniquely positioned because I had 26 years working in the private agencies and with courts to try to navigate some of these complex issues. And in the past year, I've been assigned as the division director for juvenile justice and bring a lot of experience and firsthand experience with much of the issues that we're facing. So I just wanted to point that out, and that we know that there's complexities, we know that there's a crisis, we know that there's issues, but we're definitely committed to making improvements and working with all stakeholders to, again, move that needle in a positive direction. I just felt the necessity to say that, and definitely open to discussions and can't wait to get to work.
I appreciate that, Derek, and want to affirm that that has been the response from the Juvenile Justice Division since the start of this project. When we send these slides in advance, we're always nervous on what folks are going to say and how defensive folks might understandably be. And Derek and his team have been incredibly open and continue to be incredibly open and see this as an opportunity for improvement. So thank you for that, Derek. Other questions or comments, Justice Clement?
Just an observation, and I can't help myself but to share this, as I heard, especially this part of the presentation and the findings. I really think it just emphasizes that we need to put a priority on juvenile justice. And I think that the state of Michigan has for youth in our child welfare system. But we're talking about youth still in the juvenile justice system. And when we're talking about all of these issues, we have issues in the child welfare system as well, and we're working through them. But I would just like to reiterate that that's why it's so important that we prioritize the juvenile justice system.
Thank you, Justice Clement. And probably should have said at the beginning, we're going to send out the slides or post the slides. And part of the benefit of having a March meeting that's more flexible is sometimes we know folks this is a lot of information and need time to digest it. And so we will have time for further questions and observations in March. But let me go through then the last set of slides. We're almost there. And then thinking positively about opportunities for improvement, and then questions or comments from the group. So just like with detention, want to really uplift that youth of color are disproportionately likely to be placed out of home, and that there hasn't historically been sufficient statewide commitment to ensuring that the residential system serves them effectively. So similar to what Nina presented, this chart shows the relative rate index for Black and Hispanic youth. And what the data shows is that Black youth are placed, again, this is only state ward data, but at 3 times the rate as state supervised white youth. The county placements we have, the numbers are small, but that data, potentially because it has a higher proportion of rural communities, but suggests an even higher relative rate index that's almost 5 times the rate of white youth. We mentioned before that the Native American population is too small for us to do a relative rate index, but also significant concerns identified about disproportionality with the tribal population as well. So again, similar to detention, significant disproportionality in the use of out-of-home placement for Black youth. Similarly, we tried to look at lengths of stay and whether there were any differences by race, ethnicity, and overall, we didn't find any statistically significant differences in private or state facility placements, but we did find a statistically significant difference in the length of stay for the amount of time youth are spending in detention as part of their placement experience. So you see white youth on average 55 days in detention as part of their placement experience, while Hispanic youth, that's 80 days. And for Black youth, that's almost 100 days spent in detention as part of their full experience in residential placement. And to Judge Braxton's comment earlier and our response, part of that is statewide policies and consistent practices, but part of it is an intentional effort to limit residential disparities and improve residential outcomes. And that starts with a statewide infrastructure. And while there is, I think, one committee in the state devoted to residential placement disparities, there's really a lack of statewide forums and collaboration specifically focused on youth of color and tribal youth and how the system is treating them. One of the challenges that we've had, and this is at the most basic level, is despite the data that we've presented, we thought it was incredibly important to present race ethnicity data, but we don't have 100% confidence in it. It is not collected consistently across county. And so that really limits a really full and robust and ongoing understanding of data. We heard many times that tribal youth were being coded as Hispanic or were being coded as Black. And so at a minimum, the importance of data standards for race, ethnicity being consistent across the state, because data collection really is the foundation of disparity analysis and improvement. At the staffing level, concerns about whether there's been an intentional effort to align the demographics with the staff that work in facilities and the staff that run facilities and run treatment providers, and how that reflects the demographics of the population served that are largely youth of color. Even on our working groups and our advisory groups, making sure that we had voices and perspectives from all communities and demographics has been a real challenge. And so concerns about the intentionality of the effort to make sure that the workforce around juvenile justice really reflects the population being served. Similarly, in terms of interventions, we know that it's important that services for youth of different races and ethnicities are culturally competent. And there's an increasing research base and emphasis on more grassroots services, such as credible messengers and other community-oriented approaches. And we heard very little mention of that, both for residential programs or for re-entry in our focus groups. And then staff training. As far as we're aware, limited, if any, formal training, certainly no training required on explicit or implicit racial bias, on cultural competence, whether that's for judges, for attorneys, for residential providers, for reentry providers. And so these kind of 5 hallmarks of a commitment to trying to improve outcomes for youth of color, many gaps in the current approach in Michigan. So lastly, final finding, and then we'll talk about quality assurance in data is, as has already been alluded to, really a lack of a specific quality assurance and data collection infrastructure for juvenile justice. So at the licensing level, there are licensing standards for the QRTPs generally, but there are no specific licensing standards or considerations for justice-involved youth and for QRTPs that serve primarily or exclusively justice-involved youth. The licensing staff that conduct the reviews for facilities that serve exclusively juvenile justice youth have no specific experience, expertise, or background in juvenile justice or training in juvenile justice. And sort of tellingly, I think is just like a really discrete, concrete sign of the fractured approach. Licensing staff, when they come on site and they are reviewing case files for providers, they are only looking at case files for state wards and not county wards, which I just found as a sort of concrete example that speaks to how some kids are being left out and not being treated in the same way as other kids in terms of quality and accountability. Likewise, as we've discussed for risk assessments, there's some limited kind of one-time training, but there's no formal system around assessment fidelity monitoring. And the research is pretty clear: without quality assurance, assessments may not be done correctly, they may not be used at all. And so risk assessments really not going to get a whole lot of benefit if it's not really being done consistent to the research. And because they're being done inconsistently and not in a centralized way, there's really no ability or capacity to actually collect and use the data on kids' risk level, on their need data for case planning, for services to make sure that kids are actually being matched to services that address their needs. So that the lack of a risk assessment quality assurance infrastructure really undermines the service infrastructure. And then likewise, the licensing reviews and the audits that are done are really not specific to services. They are more on health and safety kind of standards. So there's really no formal evaluation of what kind of dosage of services are kids getting? Are they participating in programs? Are they the right programs? Are they being implemented correctly? There's really no dedicated statewide structure for juvenile justice evidence-based programming in facilities or in the community. And as mentioned, a lack of specificity and accountability around things like family engagement or trauma-informed care. And so finally, as obviously is very apparent through this presentation, basic data is unavailable in part because of the fracturing of the system and the lack of a centralized case management or data collection system. Importantly, to be able to not just describe the system, but to evaluate and improve it. So how many youth are placed annually? How many are placed at point in time, which is sort of a critical question to be able to understand bed capacity and what kind of beds are needed. How do placement rates vary across counties, and is placement being reserved only for those youth who are high risk and are risks to public safety? Again, because of the lack of reliable and accurate race data, understanding the race ethnicity of youth in placement and what's driving those disparities. Are youth receiving services matched to their needs? Are they receiving the services in the degree and the amount they're supposed to? Are they completing programs successfully? How long are kids staying? How do lengths of stay differ? Do shorter or longer lengths of stay lead to better or worse outcomes? I mentioned incidence rates and incidents. We didn't feel like that data was reliable or accurate enough to be able to report. Hard to hold facilities accountable, or hard to understand how youth of different demographics are being treated without reliable incident data. And ultimately, as folks have already raised, what are recidivism rates? What are revocation rates? What are educational and vocational outcomes? And importantly, how do those outcomes differ, whether it's by county, by facility? And that's not just to hold poor performers accountable, but the absence of that data doesn't really allow to be able to uplift those promising and those best practices that we know are being implemented so they can be supported through resources and be adopted statewide. So what are some possibilities or big picture ideas to potentially have a different kind of system and envision systemic solutions to some of these challenges? Well, the out-of-home placement working group will have its hands full, but here are some big ideas around how to think about transforming the system. One is, how can Michigan ensure that out-of-home placement is used only for youth that are a real risk to public safety? Or have needs that can't adequately be addressed through, importantly, a very robust and a well-resourced system of community-based alternatives, whether that's risk assessments, whether that's predisposition reports, whether that's eligibility requirements, what kind of statutory change, court rule change, funding changes can ensure that out-of-home placement is truly a last resort. Likewise, how can Michigan have a more centralized, coordinated approach to what the system should look like, how many beds are needed, how the system is funded, how lengths of stay are managed, and bed utilization, including, really thinking big picture. Does the current kind of bifurcated approach to wardship work, or is a different overarching kind of structure needed to support that centralized approach? How to ensure that all youth, regardless of wardship, regardless of county, regardless of case manager or facility, benefit from a consistent set of research-based assessments, services, case management, and re-entry policies and practices, and how to develop the statewide capacity to support the implementation and the training and the quality assurance necessary to ensure that youth actually do receive those services and supports and they are being implemented effectively. How can Michigan really develop an intentional and comprehensive strategy to reduce residential disparities, both in the use of facilities, but also a specific effort to improve residential outcomes for youth of color and for tribal youth, to put on the table not just things like training, but community investment and funding incentives to put resources behind action. And then what is a quality assurance and leadership and statewide approach to juvenile justice look like that is maybe related to, but certainly separate and distinct from child welfare? How to really match what people want to see out of the state with the resource capacity, mandate, and infrastructure needed for the state to play that kind of role and help improve outcomes for youth statewide. And then finally, lots of historical discussion, but what steps does Michigan really need to make to commit to having statewide data infrastructure to track, evaluate, and improve the residential system, and having the data and analytic capacity to do that. So that's a lot. It's a miracle. We made it sort of on time. I do want to just allow a few minutes for any questions or observations, and then I know the Lieutenant Governor has some concluding thoughts, and then we'll quickly talk about next steps. I apologize, I spoke for too long. But any final comments, questions? Again, we will have time in March for further deliberation, so we know it's a lot. Lieutenant Governor, did you want to add some comments?
Sure. Thank you, Josh. And I just want to take a step back. And I know we've been listening to a lot, but just to try to set the energy level, this is what we've been waiting for. You know, all of us who are part of this task force, who are folks who are working to support this effort to, you know, understand the current system so that we can imagine a system that's going to, you know, position more young people for success and support and better opportunities. We've been waiting for this opportunity to get the kinds of insights that we have not had access to in a comprehensive way, at least. Now, there's so many folks on this call who have been working in, living in, impacted by this system for a number of years. And so your experiences combined with this data collection and analysis process is really, I believe, going to position us working through this task force, working through the work group structure and process to be able to create some very insightful recommendations that I believe will be impactful. And I'm so thankful that this group is as broad and diverse as it is, and that it represents so many folks from so many different parts of the system and those systems that are impacted or adjacent to it, that I think we're going to be able to build the consensus to really help Michigan's system work. So I just want to thank our CSG teams. I want to thank SCAO. I want to thank just all the folks who contributed to getting us to this point right now, because this is setting us up for the work that we came here to do. And I'm excited to be engaged in this with you. I learned a great deal in this conversation. I'm going to be diving into these slides very deeply between now and our next meeting. And I'm sure I'm going to have questions to follow up with the CSG team, so be ready for that, please. I also just want to acknowledge the fact that, as was stated at multiple points during the presentation, there are good things happening in Michigan. And where there are bright spots, we need to brighten them and broaden them so that more those bright spots are happening in more places. And then where there are areas for opportunities, let's put our heads together and be creative about how we can, again, sort of make this system not just be optimized, but really be designed from the ground up to respond best to children's, families, communities, and our state's needs. So just thanks for the engagement, everyone. We're going to be able to do this. I am both hopeful and optimistic that we can land in a place where we will achieve the kind of progress that we're seeking. So thanks for participating, for getting through the meetings to this point. And we're getting closer to that point where we're going to all roll up our sleeves in the room and figure out how we can build consensus for the future.
Thank you so much, Lieutenant Governor. At the risk of following those comments, it is worth saying one incredibly important note of optimism, which is, I think, pretty universally in all of our focus groups, folks were really excited about the idea of change. And that's actually often not the case in many states where we work. There's defensiveness, there's kind of playing down the extent of the challenges. And so even though this might seem a little overwhelming to folks, we were really heartened by people really feeling like the system could change, should change. And the response that we've gotten to the working groups and participation in the working groups has also been pretty overwhelmingly positive. So we're really excited to be partnering with folks moving forward. Just in terms of next steps, and Nina, if I miss anything, one is, so we've got the March meeting on the books. That'll be a shorter meeting. We'll send out an agenda prior to that meeting. We hope to schedule that April meeting where we'll do the deep dive of the front end of the system. We didn't see too many comments in the chat, but please email Nina if you've got concerns about attendance at that meeting, because we want to get that on people's calendars soon. Stephanie put the link in the chat to the listening sessions. We do think it's really important if you can make the time to hear directly from youth and families, not filtered through us, about their experiences with the system. And so really want to encourage you to sign up for one of those if you're able to. We think it's a really important experience. And then we'll be sharing the presentation on the website and in other ways. As Lieutenant Governor said, we're happy to engage with you if you've got questions or want to discuss further. And otherwise, we just really appreciate your time and your patience with us going through all of this analysis. Nina, anything else?
Nope, I think you covered it.
Okay. Everyone deserves a break, a drink, whatever you need to do. Thank you all for your time. We appreciate it, and we'll talk soon.